Good afternoon, everyone. We're going to call this meeting of the Health and Human Services Subcommittee to order. And one of the things that we want to try to ask is that we're trying our best to make sure that we're accommodating to each and every one. We're going to treat that adjacent room as a part of the hearing room. So if we can keep it down a little bit out in the adjacent room, we also have audio in the respective adjacent room from that standpoint. We're not going to close the doors. We're going to make sure that the double doors are open. And at this time, we have colleagues, one agency report, which is the Maryland Department of Health, Developmental Disabilities Administration. And we're going to ask Ms. Victoria Martinez to give us the readout.
Thank you, Mr. Chair and members of the committee. My name is Victoria Martinez, and I'll be going over the Developmental Disabilities Administration budget analysis. DDA provides services to individuals with intellectual and developmental disabilities, primarily through community-based services. As you can see on the first page of the analysis, the fiscal 2027 allowance decreases by $542 million, or 14%, for a total of $3.3 billion. Since these spending trends include cost containment and a deficiency that adds funding in 2026 to cover spending in 2025, Exhibit 1 on page 3 more accurately shows spending trends. From 2026 to 2027, the community services budget decreases by 4% when including cost containment, but increases by 4% when excluding cost containment. Moving on to the Managing for Results performance measure analysis, beginning on page 5. The first MFR discusses DDA's goal of increasing enrollment in their Medicaid waiver program to allow DDA to claim federal funds for services. DDA previously operated 3 waiver programs, but as of October 2025, DDA consolidated these waiver programs into only one waiver, the Community Pathways Waiver. Exhibit 3 on page 7 shows that enrollment increased for a total of 19,158 participants served in the waiver in fiscal 2025, which is 90% of the total slots that DDA was authorized to fill. The second MFR, beginning on page 8, discusses waiting list placements. Exhibit 5 on page 9 shows that the number of individuals waiting to receive DDA-funded services decreased by 15% to about 3,400 in 2025, showing improvement in decreasing the wait list. And the last MFR discusses performance in meeting 3 goals relating to timely review of person-centered plans. Exhibit 6 on page 10 shows that performance decreased in 2025, with only 62% of plans submitted by coordinators of community services submitted in a timely manner. Since participants need an approved plan to receive services, timeliness is very important. So DLS recommends adopting narrative requesting more information on PCP review processing times and efforts to improve timeliness. Moving on to the fiscal 2025 portion of the budget analysis, beginning on page 11. In fiscal 2025, DDA reported a total shortfall of $356.6 million, and the deficiency adds funding to fiscal 2026 for this purpose. DDA also submitted a report on advance payments given to assist providers in their transition to LTSS, and Exhibit 7 on page 13 shows advance payments and recoupments with a total of $2.3 billion of advance payments provided, most of which have been recouped, but DDA should comment on when the recoupment process will be complete. DLS also determined that this report is in compliance with the budget bill language and recommends that withheld funds be released, and will process a letter to this effect if no objections are raised during the hearing. Fiscal 2025 also included a large increase in spending from the Waiting List Equity Fund, as shown in Exhibit 8 on page 14. The fund balance had accumulated in recent years, but because of a change in the BRFA of last year, the balance was completely expended in 2025. Moving on to fiscal 2026, the fiscal 2026 budget added $34 million general funds in 2025 and 147 million general and special funds for 2026 to partially restore funds for cost containment actions. The bulleted list beginning at the bottom of page 14 and going on to page 15 summarizes the funding that was added to modify or fully restore funding for cost containment actions in 2026. In addition to the 356 million deficiency for the fiscal 2025 spending, there's also a 380 million deficiency for shortfalls in fiscal 2026. There's also a fund swap that provides 17 million in special funds from the Community Services Trust Fund, which is estimated to be the full balance of the fund to provide an equivalent amount of general fund relief. However, 15 million from this fund was transferred in fiscal 2026 for cost containment actions, so the fund does not seem to have sufficient balance to support this deficiency, and DLS has asked DDA to discuss plans to replace the 15 million general fund need. The last thing to note on fiscal 2026 is that there is a decrease of 169 million from 2025 to 2026. Exhibit 9 on page 16 shows the components of spending change, and although a portion of this decrease is due to cost containment actions, it's unclear why the budget decreases further, so DDA should discuss the reasons for this decrease and any concerns about the fiscal 2026 budget. Moving on to fiscal 2027, Exhibit 10 on page 18 shows an overview of agency spending in fiscal 2027. About 98% is for provider payments in the community services program, most of which is for residential services, followed by meaningful day services and support services. The remaining 2% includes spending for utilization review services, regional offices, and other operating expenses. And Exhibit 11 on page 19 shows community services spending by service model. Exhibit 12 on page 20 provides a breakdown of the 542 million decrease from the fiscal 2026 working appropriation to the fiscal 2027 allowance. Most of this change is within the community services program, and Exhibit 13 on page 22 shows the primary spending components. The budget includes increases of 76 million for service utilization growth and 74 million for new enrollment, but these increases are offset by larger decreases of 356 million to remove the deficiency for 2025 and 299 million in cost containment actions. To better understand service utilization, which is the biggest increase in the budget, DLS recommends adding language restricting funds pending a report on utilization trends. In terms of personnel that's discussed on page 23, there's a slight increase in contractual positions in the fiscal 2027 allowance. The vacancy rate remains high with 28 vacant positions, which are shown by program and position type in Exhibit 14 on page 24. Since most vacant positions were developmental disabilities program coordinator positions, DDA should discuss the impact of these vacant positions on PCP approval times and efforts to improve recruitment. The first issue, beginning on page 26, discusses community services spending growth. Exhibit 19 on page 26 shows actual community services spending compared to the original legislative appropriation, showing that spending has increased rapidly. Spending has more than doubled in a 3-year period from 1.7 billion in fiscal 2022 to 3.6 billion in 2025. Most of this spending was not originally budgeted for in the legislative appropriation and required significant deficiencies in subsequent years to cover the shortfalls. Exhibit 18 on page 28 shows what drove the spending growth. This was primarily due to costs related to the transition from a prospective payment model to a fee-for-service billing system in LTSS. The LTSS transition led to about 18% higher overall costs for two main reasons. The first is higher rates that were incorporated that were based on a rate-setting study. And the second is increased utilization over time due to additional flexibility in service billing. The budget also increased due to various provider rate increases that were costs that were expected and budgeted for, which are listed in Exhibit 20 on page 30. The next couple exhibits show spending trends in fiscal 2025, which was the first year in which all providers transitioned to LTSS. Exhibit 21 on page 32 shows spending by service, with 4 services: community living group home, personal supports, dedicated hours, and community development, accounting for 85% of total spending. Exhibit 22 on page 33 shows the participants served, and Exhibit 23 on page 34 shows the cost per participant by service type and service model. Exhibit 24 on page 35 shows more detail on cost per participant by specific services. It's important to note that cost per participant varies widely for participants, both within and across service models, because plans for receiving services are tailored to every participant's needs. Data from DDA's second quarterly spending report shows that spending in the first quarter of fiscal 2026 totaled $839 million. DLS determined this report to be in compliance with the budget language and recommends that withheld funds be released. And DLS also recommends adding language restricting funds pending quarterly reports with updated spending data. The second issue, beginning on page 36, is on cost containment implementation and cost neutrality. DDA submitted a report on the implementation of 7 cost containment actions in 2025 and 2026, which are summarized in the bulleted list on page 37, and Exhibit 25 on page 38 shows the updated savings amounts from these cost containment actions, showing that general fund savings were $9.9 million lower than originally estimated. This issue also describes in more detail the implementation of the state-only funded services action, which is summarized in Exhibit 26 on page 39. And as of the report, 136 participants were removed from services due to this cost containment action. DLS determined this report to also be in compliance with the budget bill language and recommends that these withheld funds be released. For fiscal 2027, the allowance includes 4 proposed cost containment actions, which are summarized in Exhibit 27 on page 41. 2 of the cost containment actions would impact self-directed service participant employee wages by modifying reasonable and customary wages to align with BLS wages, and also eliminating the wage exception process to pay higher wages. Exhibit 28 on page 42 compares the current reasonable and customary wages to this BLS wage, and wages for all services would decrease except for employment services and support broker services. Although the BLS wage is one component used to develop traditional provider rates, traditional providers have flexibility in paying wages above or below the BLS wage. So DLS has asked DDA to provide average wage paid to employees in the traditional services model to better understand how wages compare. Another cost containment action implements a cap of $500,000 on PCP budgets and is estimated to impact about 1,600 participants. Exhibit 30 on page 44 shows the range by which participants exceed the proposed cap. To monitor the implementation of cost containment, DLS recommends adding language restricting funds pending a report with details on the implementation of these cost containment actions. The last thing I'll discuss is cost neutrality, which is discussed on page 45. Since CDA provides services through a Medicaid waiver, they must meet certain federal requirements, including demonstrating that the cost per person to provide services through the waiver is at least equal to or less than the cost to Medicaid in operating institutional programs. Exhibit 31 on page 46 shows this cost neutrality calculation. As shown, the gap between the two decreases significantly in 2026, and this is mainly driven by a decrease in the estimates for institutional costs based on a revised methodology. And to summarize the DLS recommendations, DLS recommends adding language restricting funds pending reports on community services spending, utilization trends, and cost containment implementation, in addition to adopting narrative requesting a report on PCP review timelines. DLS also recommends restricting funds in the community services program to that purpose only. And that concludes my presentation. I'm happy to take any questions.
Thank you, Ms. Martinez. And seeing no questions for the analysts, we'd like to call up the department.
Good afternoon, Chair McCray and members of the Budget and Taxation Subcommittee. For the record, I'm Dr. Mina Seishamani, Secretary of Health for the state of Maryland. The department thanks the Governor, the Department of Budget and Management, and the Budget Committees for their support. And we thank the Department of Legislative Services for its insightful budget analysis of the Developmental Disabilities Administration. I'm pleased to be joined today by Deputy Secretary Marlena Hutchinson and members of the DDA team to discuss the fiscal year 2027 budget. As you know, the Maryland Department of Health has the incredible privilege of serving Marylanders across their lifespan, from their birth until their final moments. And we are working every day to protect and advance the health and well-being of all Marylanders. Disability services are central to that mission. This includes providing access to a wide range of services that allow Marylanders with intellectual and developmental disabilities to live the lives they choose. The fiscal year 2027 budget is a measured proposal focused on funding services today, as well as protecting the long-term sustainability and existence of the DDA program into the future, so that it can continue to serve Marylanders with intellectual and developmental disabilities. It includes $3.2 billion in total funds for DDA, including $1.7 billion of general fund support. This reflects an increase in state funding of more than $920 million during the Moore-Miller administration. Our goal is to maintain an accessible, equitable, effective, and sustainable program of meaningful services that promotes community living through both self-directed and community provider-managed delivery models. The Community Pathways Waiver Program that covers many Marylanders with intellectual and developmental disabilities operates under a federal waiver authority that must remain grounded in services, financially sustainable, and compliant with federal Medicaid rules. Now we are in a challenging time. As we have put together the budget proposals that we are discussing today, our engagement with the disability community has been crucial to better understand how these services can best support people and their families now and in the future. Last year, the DDA team participated in more than 100 community engagement events and engaged in 41 workgroup meetings to collect feedback about program sustainability. DDA has also regularly met with representatives and participants from both the self-direction and community provider-managed delivery models. And DDA will continue to host hybrid and in-person meetings with community partners both during and after the legislative session. The fiscal year 2027 budget sustainability items are necessary to keep the Medicaid waiver program approved, funded, and operational. Without sustainability actions, the state would face a threat to its Medicaid waiver and escalating deficits, threatening provider stability, service continuity, and a wait list that continues to grow without moving people into services. Our mission remains the same: to serve Marylanders with intellectual and developmental disabilities now and into the future. So thank you for providing me with an opportunity to highlight the Developmental Disabilities Administration and the work we do to continue to protect Marylanders. We look forward to working with you, the Maryland General Assembly, with our advocates, with the community, as we pursue together our collective vision of a high-quality healthcare system that produces the best possible health for Marylanders across their lifespan. So I will now turn it over to Deputy Secretary Hutchinson and the team to address the specific budget questions. Thank you.
Thank you, Secretary Sessions. Good afternoon. Chair McCray. Good afternoon, honorable committee members. The department thanks the governor, the Department of Budget and Management, and the budget committees for their support. We also thank the Department of Legislative Services for your very insightful budget analysis. I'm going to go through the specific questions from DLS and provide responses. So in regard to page 11, considering the importance of timely person-centered plan reviews and participants' access to services, DLS recommends adopting narrative requesting a report on PCP processing times. The department concurs with this recommendation. Next, on page 12, DLS determined the report on fiscal closeout and advance payments to be in compliance with the language and therefore recommends that $500,000 in withheld general funds be released. The department thanks DLS for its review and its recommendation to withhold, to release the funding. I want to say in regard to the advance payments, DDA, we are very proud. In less than 2 years, we are very proud to report that the original $468.6 million in advance payments that were due to the department, 90% of that has been collected. And so that's representing 90% of the total balance being approximately $422 million. Of the 225 providers who received reconciliations, 179 have entered into a payment plan or are in active appeals with the Office of Administrative Hearings or no longer carry a balance owed to the department. And then we do have several providers who are in active negotiation with the department. We anticipate resolving the remaining balance by the end of this fiscal year 2026, which is June 30th, 2026. Next, on page 15, DLS is asking for our comment on the current fund balance of the Community Services Trust Fund and whether the fund has a sufficient balance to support the total transfer of $32.6 million. The current fund balance is $17,770,000. We are working with our DBM partners on a supplemental deficiency to adjust the current year special fund appropriation for this item to better align with available revenue. Next, on page 17, DLS asked us to comment on the reason for the decrease of $127.8 million in fiscal year 2026, and whether higher spending is anticipated in the second half of 2026. So I want to just clarify that in fiscal year 2025, we spent approximately $3.2 billion in total funds, which when you combine that with our Schedule F deficiency of $356 million, it totals about $3.58 billion in total funds. We would also like to note that the fiscal year 2025 expenditures include approximately $238 million in claims from previous fiscal years that lacked a fiscal year 2024 accrual support, and they were therefore paid in fiscal year 2025. So reducing those fiscal year 2025 expenditures to account for expenditures tied to prior service year claims results in reduced fiscal year 2025 expenditures of about $3.3 billion. So when comparing the revised fiscal year 2025 total to the proposed fiscal year 2026 budget level of $3.4 billion, we actually now see an increase of about 2% in expenditures. And if we don't factor in the cost containment proposals, it's about 4.33%. And that's in line with our current expectations for our annual expenditure growth. We also would like to note that we are continually refreshing our projections as new Medicaid claims are submitted to monitor the potential for an increase in utilization for the second half of this fiscal year. And we will continue to work with our DBM partners to review ongoing 2026 projections. Next, on page 22, DLS recommends adding language restricting funds pending submission of a report on utilization trends in LTSS Maryland, including a comparison of service utilization and PCP budget utilization in LTSS Maryland compared to our legacy system, which is PCIS2. The department concurs with this recommendation. Next, on page 23, we are asked to discuss the impact of vacancies on our timely review of person-centered plans and the challenges for filling the roles, and also any efforts being taken to improve recruitment and retention for these positions. We would like to say that the vacant positions have had minimal impact on our ability to review participants' person-centered plans in a timely manner. There are variables impacting timely review, including but not limited to waiting for documents, any documents that are submitted without signatures, plans returned due to insufficient documentation to support the assessed need, delays in responding to clarification requests that go beyond our service level agreement of 5 business days, and plans pending an appeal hearing with the Office of Administrative Hearings. We have been successfully working through the process to obtain exceptions to the statewide hiring freeze for recruitment. And our current vacancy rate is driven by hurdles in the recruitment cycle, including extended posting and vetting timelines, compounded by a high rate of candidate drop-off and interview cancellations. Additionally, a high number of applicants do not meet our position qualifications, or they decline our positions due to salary concerns. We are actively investigating ways to leverage technology and feedback to streamline these processes and improve our ability to efficiently secure qualified candidates. And while these key recruitments are underway, we have implemented a system to reallocate internal resources and team members when necessary to support other team members in meeting our 20 business day person-centered plan review process and service level agreement. Next, on page 36, DLS determined that the second quarterly report on community spending is in compliance with the language and is recommending that the funds be released. Again, we thank you for your review, DLS for its review, and its recommendation to release the funding. Next, on page 36, DLS asks or recommends adding language restricting funds pending the submission of quarterly reports with spending data in LTSS Maryland for fiscal year 2026 and 2027, including updated spending, participation, and service provision data. The department supports this recommendation as we do believe it's important for legislators and the public to have visibility into our spending. We respectfully request reconsideration of the deadlines, however, for this requirement. It will enable us to produce accurate reports because the deadlines on page 47 actually come in at a time where we're working on closeout and so forth. So it's a very busy time at that time. Next, on page 40, DLS determined that the report and cost containment actions implemented in fiscal year 2026 are in compliance with the language and recommends releasing the funds there as well. And again, we thank DLS for its review and the recommendations to release that withheld funding. Next, on page 43, DLS asked for the department to provide the average wage and range of wages paid to direct support employees in the traditional services model for services that would be impacted by the cost containment action in the self-directed services model. And so we would like to clarify that any changes to reasonable and customary wages or the wage exception process in the self-directed services delivery model will not affect the rates or wages paid to direct support employees in the community provider managed model. The rates in the community provider managed model are set in accordance with our CMS endorsed BRIC methodology, which is also vetted by our rate review advisory group. Providers have the flexibility to set their direct support professional rates based on statutory minimum wage requirements or the minimum wage in their respective locality. Based on the most recent Maryland wage data from the 2024 National Core Indicators State of the Workforce Survey, which our providers are required to complete, the average hourly rate for direct support professionals was $18.48. The median rate was $18, and the minimum wage, of course, is $15 an hour. We did see a maximum of $29.06. We've also included in our written report an appendix, which includes the infographic published by NCI for more information. Last, on page 45, DLS asks the department to monitor the implementation of fiscal year 2027 cost containment actions, and the department does acknowledge this recommendation. That is the conclusion of my report.
Thank you, Senator Jenny.
Thank you. First of all, Secretary Hutchinson, I do want to say I have to thank you very much for your accessibility to both me and my staff, both you and your staff. Over the last year, you have been in my office repeated times to meet with me, and I want to thank you. I really appreciate that. What you were trying to deal with, it is a Herculean task trying to get this. I know you've inherited somewhat of a mess and trying to deal with it, so I appreciate that. And so the thing that kind of stands out to me, and one of the things we've tried to deal with in this subcommittee and the committee as a whole, kind of goes back to page 26, Exhibit 16. And I think this is the one that this slide kind of shows that projection of such a large increase in expenditures, where it almost goes from 2020 of 1.3 billion to last year of 3.6. And I think that's one of the issues that has gotten us into this issue, especially on the budget side of this cost containment. How do we, what has caused this growth so quickly? And it's got us in the position where, I'm going to try to deal with the budget side of it, but also trying to help these families, making sure that they have the adequate services that they need and provide, but, find that happy medium. So if you could take a minute and just help explain to me what has kind of got us to this point, if you wouldn't mind, or would it be you or somebody else from your team, just to help refresh my memory, if you wouldn't mind.
Sure. So as DLS's exhibits demonstrate, we've been on an uptick since 2021. So beginning in 2020, we had COVID, we had provider rate increases, we had flexibilities that we built into the budget. We, at the time, had some additional federal support that we no longer have access to. And then when we get closer to this fiscal year and last fiscal year, what we've been noticing is an increase in utilization. And we've noticed two primary cost drivers. And so part of our engagements last year in speaking with the community was being very visible and clear, transparent about what the cost drivers are. We see a huge spike in utilization in personal supports under the self-directed services delivery model. And then we also see an increase in utilization for dedicated hours under the residential services model on the community provider side. So that's where we're beginning to see this the billing behavior, the increased utilization translating to expenditures there.
Are we seeing more people using the self-directed care versus, did more switch over to that versus the other type of care throughout this time frame, or no?
So we have been looking at enrollment by way of our, one of our waitlist categories is transitioning youth. We are seeing a difference in selection for self-direction for those who are entering in from out of the education system into DDA. So we're seeing an uptick there. And we have noticed that there have been some individuals who have elected to leave the community provider managed model and come into self-direction. So we are seeing that trend there.
Okay. And I know salaries is a big issue. We've dealt with it before. When I used to be on the finance committee, it was something we addressed. And you actually kind of mentioned that you have a high rate candidate drop off, and I think you said a lot of due to salary concerns. How much of this cost containment is dealing with salaries? Are we trying to deal with? Are we? And I know some of the stuff I've read, because I've gotten piles of information sent to me that I've been reading through, and I have advocates that send me stuff. I have your agency that sends me stuff, and I have third parties that send me stuff, and people highlight things, and I see where you've got these sliding scales. Some people are paid different rates. Some are exorbitant, others are much lower. I'm trying to figure out where I'm trying to frame this question in my mind, but it comes down to salaries with cost containment. Are we? And you mentioned, so was it $18 an hour?
That's on the community provider side.
Oh, okay. So that
Yes.
doesn't apply to the. Okay. So I guess is one of the ideas for cost containment to lower salaries? Or is it to just keep them in check? I mean, I'm trying to understand.
So one of our sustainability proposals is around aligning the reasonable and customary wage standard, which is offered under the self-directed services delivery model, aligning that with Maryland's Bureau of Labor Statistics, which is what providers use, which is identical to providers. And so that sustainability proposal addresses that alignment, which has been flagged for us by CMS as an issue. We currently do not have a methodology for our reasonable and customary wage standards. So the department is proposing to align with the BLS, as well as eliminate the wage exception process associated with the reasonable and customary wage standard.
Can you just explain to me what's the wage exception process?
The wage exception process allows a family member or participant to pay above the range that on the reasonable and customary wage standard. Usually this is used because a family member or participant may want to provide additional, a higher hourly rate to their direct support professional for personal support services.
Okay. And is there any auditing of this, any overview of these programs for these?
Any auditing of the program?
Yes, like, like for the, when you have family members watching each other, looking over it, anything like that?
So the department does have, we have case managers that work
Okay.
very closely with the participants. They serve as our agents to serve as our eyes and ears. We have also have a quality improvement organization looking at service delivery provisions as well.
Okay. Okay. I think I'm good, Mr. Chair. Thank you. Thank you.
Mr. Senator, I would just also like to put on the record that CMS, another thing that CMS flagged in our conversations in regard to not having a methodology for reasonable and customary wage standards is we're the only state in the nation that has a wage exception process. Also, no methodology there.
Okay. Thanks.
Thank you, Madam Secretary. Just one question and a couple requests. One of them is in reference to the folks that are reviewing the person-centered plans. How many vacancies do we have in that specific space?
So we've already identified staff to serve in that capacity. This plan review to do the wage exception process will be a multidisciplinary team of licensed nurses, behavioral support specialists, regional team plan reviewers, and so forth. So we've already identified a committee of 13 individuals who will be looking at those exceptions. No vacancies there.
Okay, and just want to clarify again, so within the 28 vacancies of the agency, none of them are the folks that do the person-centered plans?
So just to be very clear, we have some regions that need plan reviewers. We've been level loading there to make certain that we remain within our service level agreements. However, for this multidisciplinary team that will be doing the exceptions process, we are fully staffed.
Okay. The ones that you were talking about that were vacant at some of the specific regions, if you can get us how many they are and how long they've been vacant, that would be helpful. Yes, ma'am. Senator Zucker.
Thank you very much, Mr. Chairman. And I want to first echo Senator Jennings. You and your team have been just amazing in terms of accessibility and communication. I guess more of a, kind of a comment, but and the wait. I'm going to start putting my back into this a little bit. So we gotta figure out how we keep that going and ensure that it's spread across the board. Part of the thing that we wanted to do with End the Wait was originally the focus had been on the autism waiver, which is very important. I know that doesn't, I know you care about that population. I know it doesn't necessarily, it's a different agency, but it really, the intent was to kind of spread it across the board. So let's try to work together on that. But I'd like that to, I don't want the program to end. I know that the speaker, actually now the Speaker of the House and I sponsored the legislation, and it was really aspirational because it wasn't a funding mandate. But without us, without the leadership in this room, it just won't continue. So we need to, I'm gonna put my back into it, Mr. Chairman. I know that it's a concern. I know it's a priority of the subcommittee as well. But let's keep that going. Thank you, Mr. Chairman.
Colleagues, seeing no further questions, with the public testimony, what we're gonna do is we normally call 5, and we're gonna call 3 just to make sure that everything's pretty much manageable. And at this time, if we can have Tim Weems, Nathan Holland, and Shayna Farlow.
May I have his support staff? She's testifying too. Her name's Christine Gott.
Yes, ma'am.
Could you do it at the same time so you know who she's talking
Yep.
about?
And you said, can you spell her last name? You said Christine?
Gott.
T-O-T-T.
Start. Good afternoon, Chair McCray, members of the committee. My name is Tim Weems. I am the Executive Director of the Maryland Inclusive Housing, MIH. We were formed about 6 years ago to help the State Developmental Disabilities Administration move services from a group home model toward a supported living model. Individuals with intellectual and developmental disabilities who choose not to live in a group home or can no longer live with their families need help to find affordable housing, and that's our work to do that. We are funded in 3 ways. We have a grant with DDA for $260,000. We have a grant through Maryland Medicaid, Money Follows the Person, for roughly similar amount. And then we provide what's called housing support services, which are covered under the Maryland Medicaid waiver, and we bill for that. The DDA grant and the Medicaid waiver funding are in the governor's proposal for FY27 at the same levels as FY26, and we urge the funding of those requests. The details of our work are included in written testimony that I've provided to you. One of the things that we do, in addition to providing some of those services, is do advocacy. Part of the DDA budget includes a DDA rent supplement program that started maybe 2 years ago. There are roughly 25 people in that program now. They have a funding for about 50. We're urging additional funding for that program to continue to grow. There are 600 people on the waiting list for those subsidies to help people pay for the housing if they're not living in a group home or with their families. We are also advocating with the Maryland Department of Housing and Community Development to make changes in their low-income housing tax credit program so that more people with IDD can benefit. Thank you for your time.
Hi, my name is Shayna Farlow. I have been a nurse for 25 years. I am the sister and legal guardian of my 2 brothers, Andrew, who didn't make it today. He has the same condition as Nathan. Andrew's 43, Nathan's 34. My brothers have, you want to hold it for Andrew? My brothers have leukodystrophy, a devastating brain disease that has left them functionally quadriplegic, but they can still feel. They feel pain, they feel comfort, they feel stability. They depend entirely on caregivers for everything: feeding, bathing, medications, repositioning, even something as simple as scratching an itch. Because of DDA and REM services, my brothers are able to live in their home together in their house where they grew up. They are not just surviving, they are thriving. They plan meals, they help cook, they go into the community, they are reading and writing again. And after losing our mom and going through so much change, they are finally stable and happy. I will share that I tried respite in an institution once, or facility. Andrew, my other brother, he has scoliosis in his back. He went with 150 Vicodin. He was there for 3 days. I had to go pick him up. He came home with 0. He had a burn across his belly. I mean, institutional care is not a safe option that's when I realized that. And that's why we went into self-direction. Last week, DDA denied my other brother Andrew's new plan. I found out the night before it was to begin. I was expected to tell his loyal, skilled staff the next morning that their pay was being cut immediately. This is happening now before even these proposed cuts. I refused to sign it. The reason given was a duplication of nursing services. Because he receives REM, REM has their nursing care plan. DDA does not recognize their nursing care plan. But nothing about their needs have changed, only paperwork. This is not duplication. This is discrimination against those families with REM. And please feel free to ask me more on this situation. And I just want to close with, my brothers deserve to remain at home. I'm asking DDA and the Department of Health to fix this policy with REM and DDA and the nursing care plan and protect funding that allows the most medically fragile individuals to live safely and with dignity. And I'm asking you to continue the funding that my brothers desperately need. Do you want to talk? Okay. You can do it. So Nathan wants to talk.
Yeah.
Yeah.
Mine okay.
By the way, I have no idea what he's going to say.
I do
I do
not
not
want to
want to
go
go
nowhere
nowhere.
and
And
I want to live public.
he wants to keep his sweethearts. Please.
And I will.
And he loves you all.
Well,
That's all. Tell him thank you.
they do.
And thank you, Nathan.
You will.
Thank you to all the panelists. We're going to call up Senator Zucker.
Well, thank you very much for that amazing testimony. So for your other brother, is he being taken, is it been fixed?
He's an extended now because I refused to sign it. And I got the call at 6:30 at night, the night before. And what it is REM has their nursing care plan, DDA put in a line that says, no, if you have a nursing care plan over here, DDA wants their own nursing care plan or something, I don't know. I wish these two would come together. REM has been awesome in trying to help us fix this. And, you know, it's just, you know.
I just want to make sure the caregiver, did you want to say something?
Yeah.
Please.
Good afternoon, Chair, members of the committee. My name is Christine Gott. I am Direct Support Professional from Pocomoke, Maryland. For the last 5 years, I have provided 7,639 hours of dedicated care to Nathan Holland. To most, this is just a job. To me, Nathan is like a brother. I am also a mother of 6 children. Sorry. I am here today because the proposed DDA budget cuts aren't just numbers on a spreadsheet. They're a direct threat to my family's survival and Nathan's stability. Maryland is one of the most expensive states in the country. And like other families, I am struggling with the rising cost of living. Yet instead of receiving a cost of living adjustment, I am facing a 30% pay cut due to these budget reductions. I have given 5 years of my life to this field. I have the experience that Nathan needs to stay safe at home and thrive in his community. But as a mother of 6, I cannot sustain a 30% loss of income. If these cuts move forward, the state is effectively forcing experienced, dedicated caregivers like me out of the profession. We are asked to choose between the people we care for and the children we provide for at home. When you cut the wage for self-directed services, you aren't saving money, you are creating a crisis. You are destabilizing the lives of Marylanders with disabilities and plunging their support staff into poverty. Nathan deserves the continuity of care that those 7,639 hours represent. My children deserve a mother who isn't working at a 30% deficit while inflation climbs. I urge this committee to reject these budget cuts and restore the funding for our wages. Please don't balance the budget on the backs of Maryland's essential caregivers and the vulnerable citizens we protect. Thank you for your time and your service to our state.
No doubt.
You said good job.
And thank you, Ms. Scott, Mr. Weems, Mr. Holland, and Ms. Farlow.
Thank you.
Thank you.
Colleagues, at this time, we're going to ask for Ms. Andy Culp, Ms. Laura Howe, and Ms. Rachel London.
Good afternoon, Mr. Chairman and members of the committee. I'm Laura Howe, the proud CEO of the Maryland Association of Community Services, representing 125 developmental disability providers across Maryland. We understand the fiscal pressures facing the state, and quite frankly, no one is more upset than we are to be back here. But all of the high-level discussion that we've heard has been about how the DDA budget is unsustainable. And what we need to talk about is that these cuts are unsustainable for people with disabilities and their families. The cuts will absolutely hurt people. In the community provider model, they will especially hurt people with significant disabilities and intense needs. It's important to note that the somewhat higher budgets and provider services reflect things like higher health risk screening scores for the people we support. 2 of the 3 proposed cuts land almost completely on people who use provider supports: the dedicated hours cut and the $500,000 budget cap. These cuts do not reduce complexity, they merely reduce access to needed services. Excuse me for 1 second. There we go. I can't stress enough that this level of funding is not easy to come by. It is important to note that people are already losing dedicated hours, including people being asked to use shared hours before accessing dedicated hours, and dedicated hours being removed without a change in the person's assessed need for that level of support, despite the direction you gave in the budget last year. Please do not believe a narrative that tells you that these cuts are manageable or measured or just reflect implementation of existing policy. We respectfully urge the committee to reject these proposals and to work on long-term solutions. And as always, we are incredibly grateful to the support of this committee over the many years. Thank you.
Good afternoon, Mr. Chair, members of the committee. I'm Rachel London, the Executive Director of the Maryland Developmental Disabilities Council. We're a statewide policy organization that creates change to make it possible for people with developmental disabilities to live the lives they want with the support they need. For us, that applies to all Marylanders with developmental disabilities, including the people who receive services from DDA, the people waiting for services from DDA, and the people who don't even know about DDA or that DDA doesn't even know about yet. I'm going to focus on those people first, but before I do want to acknowledge that we have been meeting with the administration and appreciate the ongoing conversations. The council is always committed to continued discussions, but we remain deeply concerned about the discrepancies in the estimates, both in funding and impact on people's lives. For example, the analysis says there's about $75 million for the new enrollment of 994 people. We understand 800 of those are transitioning youth leaving school. The analysis also says that DDA estimates 162 of those are people transitioning from state-only services. That leaves funding for about 32 people. With all the other required reserve capacity, including youth aging out of foster care, people leaving hospitals, the numbers are not adequate and appear to not even touch the 3,400 people on the waiting list or leave room for potential emergencies. We also know only 90% of the available waiver slots are being used, leaving over 2,000 slots potentially available for people on the wait list. And what about the people currently receiving services? Over 19,000 Marylanders live, learn, work, and play in their communities because of the DD waiver. Whether they self-direct or use community providers, they are thriving and need to continue to do so. So I would be remiss not to point out that this budget is not just a $150 million cut to people's services, it is a $300 million cut when you account for the federal funds left on the table. There's a lot of things to figure out. Thank you, Mr. Chair.
Good afternoon, Chair McCray and members of the committee. My name's Andy Culp, and I'm the Executive Director of the ARC Maryland, who for 65 years has supported people to live, learn, and thrive in their communities. And I want to echo what's been said so far about these cuts, that they will definitely, we feel, do harm to people and the most complex people in our system. So you have my written testimony, which details our concerns with the accuracy of DDA's spending forecasts, particularly around projected savings from fiscal year 26 cost containment measures and what providers have experienced as pervasive dedicated hours cuts through service denials and unit and user reductions beyond the containment that was authorized by this body. So I'm going to focus my verbal testimony then on addressing concerns expressed with the difference in costs for the community provider model when compared to the self-direction model. First, for context, 80% of people, over 14,000 of the people served by DDA, utilize the provider model of care. They are typically older with age-related health needs. Many do not have family to help with their supports, or they have support needs that are extended beyond what their family members can manage. And there are several who are formerly living in institutions we closed down in Maryland, Rosewood and Great Oaks. Also, the provider model is highly regulated with administrative and reporting pressures that do not exist in the self-direction model. There are DDA-imposed training, licensing, and certification requirements that are very different from the self-directed model, and these charts depict those differences. In black are the provider requirements for training and oversight, and in red are self-direction requirements. So that's not to say that self-direction isn't the beautiful model that you're hearing about. It is absolutely a beautiful model and must remain so and flexible for the people who count on it, but you can't squeeze blood out of a turnip. So please don't extend all the cuts to provider services either. Thank you.
And thank you. I just want to lean in and say thank you to all three of you all for just helping me to understand the space a lot better, just more importantly for your advocacy that you do for all Marylanders too.
Thank you.
Thank you.
Yes, ma'am. Colleagues, if we can we bring up Mr. Matt Rice, Leslie Thompson, and Michelle Gregory?
Thank you, Chair McCray, distinguished committee members. For the record, my name is Matt Rice. I am the Executive Director of People on the Go Maryland, which is Maryland's statewide self-advocacy organization for people with intellectual and developmental disabilities. I'm here to respectfully recommend that you reject DDA's proposed budget cuts. The reality is POG serves people in both the self-directed and the provider-supported model. I won't call them traditional because, again, they don't like it, and they're not. That being said, though, you have my written testimony. I will say we are deeply concerned with the proposed cuts to dedicated hours, which amount to a rate cut for providers. We are deeply concerned about the rate cuts to self-direction, which I have 2 support staff. Both are paid at the maximum reasonable and customary rate. And whether it's personal supports or any other supports, wage cuts should not happen to any DSP because they are the backbone of our workforce. You have my written testimony. I will say that if these cuts move forward as proposed, you are looking at devastating the work of people on the go, which is more than just a job to me. It is my calling. You are looking at potentially making me and my brother homeless because my mother recently passed away, and I'm now caring for my brother and fighting for him to get DDA supports in spite of them denying him without ever laying eyes on him. They are not affected by this, but we are. So please, I ask you to respectfully not go forward with these budget proposals. Thank you.
Yes, sir.
Honorable Chair and members of the committee, my name is Michelle Gregory. I serve on Salisbury City Council, and I am also the full-time caregiver and one of the direct support professionals for my adult son with significant disabilities. I just want to note that I wrote a much longer written statement, and with that, I submitted a cover page that had pictures of him and in the community and different scenarios that we face on a daily basis. His father is also one of his DSPs. We are not administrators observing the system, we are the workforce. Our daily life is structured around keeping our son safe, medically stable, and engaged in his community. Each day begins with medications, medical monitoring, mobility support, transportation coordination, and often long drives to specialists because we live in rural Maryland, a healthcare desert. Self-direction works because it allows us to build support around our son's actual needs, not around a rigid facility schedule. Budget authority and employer authority are not conveniences. They are what makes stability possible. Before we became self-directed, our son was in a provider facility program, Monday through Thursday from 7 a.m. to 2 p.m. That was the extent of his structured support. During those years, he was hospitalized in the ICU for 2 weeks at a time minimum, at least 4 times a year. Each hospitalization cost Medicaid approximately $75,000 to $100,000. Since becoming self-directed, his hospitalizations have dropped to once every 12 to 18 months. This is not just about compassion, it is about outcomes. It is about cost. Self-direction reduced crisis, reduced hospitalizations, and improved his quality of life. When wages are cut or payment systems fail, the DSP workforce becomes unstable. In rural communities, it is already very fragile. If payroll is delayed or funding disrupted, families are pushed into crisis. In our case, we are both the caregivers and the workforce. I respectfully ask for you to restore full funding to the DDA. This model works when stable. Thank you for your time and consideration.
Good afternoon, Chairman McCray, members of the Health and Human Service Subcommittee. My name is Leslie Thompson, and I'm the Division Director of Chimes Maryland in Baltimore, and also the proud parent of a young man with autism and co-occurring disorders. Chimes and its affiliates, for those that don't know, we assist individuals throughout the Mid-Atlantic region with intellectual and developmental disabilities achieve their fullest potential and live their best lives. I am sitting before you today in opposition to the proposed funding cuts within the governor's budget to the Maryland Developmental Disabilities Administration. 2 of the proposed changes, the dedicated hours policy and the individual budget cap of $500,000, will have a direct impact on provider organizations like Chimes Maryland and, more importantly, the individuals that we support. At this time, Chimes alone has identified over 15 participants who are over the proposed $500,000 K personal cap that risk losing access to critical services from Chimes and other provider organizations they may be utilizing. Services for individuals with intellectual and developmental disabilities are tailored to the individual and their unique needs and goals. For some individuals, in order to achieve their desired level of independence, they require access to one-on-one staffing or two-to-one staffing. The proposed changes threaten to reduce access to these staffing ratios and force individuals back to shared hours, a drastic step backwards for the disability community. While I understand and encourage improved management of the overall DDA budget, it should not come on the backs of some of our state's most vulnerable citizens. I encourage the legislature to work closely with the IDD community and providers like Chimes to create sensible solutions that will open doors rather than close them for people with disabilities in our state. The governor's budget must be amended to provide adequate funding to the DDA, and so organizations like Chimes and all of our partners can continue to provide for the thousands of residents across the state with intellectual and developmental disabilities. Thank you.
And thank you all, Mr. Rice, Ms. Gregory, Ms. Thompson. I want to say, just lean in and say thank you for your friendship, but also thank you for your leadership.
Thank you, Mr. Chair.
Yes, sir. Colleagues, at this time, we're going to call up Ms. Lisa Lorraine, Sherry Dexter, and Christy Russell. What's his name?
Good afternoon, Chair and members of the subcommittee. On behalf of 22 member organizations of the Maryland Equity Coalition for People with Disabilities, we respectfully recommend that the proposed DDA budget be amended to address documented equity gaps. Across Maryland, immigrant families, individuals with limited English proficiency, those without access to technology, and BIPOC communities face persistent barriers to accessing DDA services. These are not abstract disparities, they affect families every day. Liliana Baez told us that she felt completely lost navigating benefits and the DDA process for her brother Juan Carlos, who lives with significant disabilities. Only after connecting with a cultural navigator did Liliana, Juan Carlos, and their mother receive guidance in their own language and cultural context. For the first time, they felt seen and supported. In the written testimony, you will find a document showing that cultural navigators assist with much more than language. They help families understand and navigate the system within a cultural context. They help people advocate for their needs, and they educate the community, and they build trust across all parties. 6 of our coalition member organizations received $150,000 in DDA ARPA funds over 4 months in late 2024, early 2025. With these funds, cultural navigators doubled service targets, quadrupled outreach goals, and nearly all families reported increased confidence and access. Unfortunately, that was a one-time investment when the state needs systemic and equitable change. We recommend that the General Assembly establish a statewide RFP to sustain and expand cultural navigator programs and to require stronger DDA equity accountability measures, including data tracking and public reporting. Maryland has already proven this model works. Now we must sustain it. Thank you for your leadership and commitment to equity.
Thank you. I apologize. I should have asked if you all could just state your name when you start your testimony.
I'm Lisa Lorraine. Thank you.
Good afternoon, and thank you so much for the opportunity to talk to you today. My name is Christy Russell, and I live in Stevensville, Maryland, and I'm the mom to a 17-year-old autistic son. It took 18 months for us to receive a formal diagnosis the year that they said that he was autistic, and we spent $30,000 out of pocket despite having private insurance that year. Like many families, I learned about the DDA through conversations with other families, and it felt like a lifeline. We were drowning in medical debt, and our income had dropped because I had to quit my job to care for my son, and I was exhausted and isolated. And then I learned that the wait list is years long. When children with disabilities are in school and eligible for an individualized education program, IDEA protects their right to a free and appropriate public education in the least restrictive environment with the services and supports that they need to access their educational setting. And federal law prohibits the budget from denying children with disabilities these rights. And that changes once a person exits high school. There are rules that say a person with disabilities should be supported in their community so long as the cost doesn't exceed the cost of being placed in an institution. And that's a profound shift in philosophy, simply because somebody crossed the threshold into adulthood. They say that when your child exits high school, it's like falling off a cliff, and my family's at the ledge. And we remain hopeful that the lifeline we've long waited for will not be ripped away. And this is the second year in a row that the DDA budget is being cut to balance the state budget. I understand budgets, and I've managed federal budgets for many years, but we cannot keep making reductions without clear data on the human impact. We cannot strengthen community services while destabilizing the workforce that makes them possible. The DDA has repeatedly underestimated spending, and projected savings have come in lower than expected. And that tells us we need better forecasting and not more cuts. So I respectfully ask that we pause any DDA budget cuts until the state can demonstrate with clear fiscal and workforce data that any budget cuts are necessary and sustainable and have the least human impact.
Hi. Thank you, Chair and members of the committee for listening. My name is Ann Valerbone. I'm speaking on behalf of Sherry Dexter, who was unable to visit us today. We are co-leaders of Concerned Citizens of Maryland, of Self-Directed Services Maryland. Our community is here again because the DDA faces a deficit we did not cause. Yet Maryland's most vulnerable citizens are being asked to absorb the damage. If savings must be found, start with real inefficiencies, duplicative administration, delayed approvals, and constant policy churn, not only dismantling the supports that keep, not by dismantling the supports that keep people safe. I also urge this committee to include clear budget safeguards preventing DDA from cutting wages or hours from direct service professionals across both models after session ends. The proposed $62 million reduction to DSP wages is alarming. Many workers would drop from roughly $32 an hour into the low 20s, more than a 30% cut. They will leave. When they leave, care collapses. Costs do not disappear, they shift, often at far greater expense to the state through hospitalizations and institutional care. At the same time, the department proposes capping individual budgets at $500,000, with exceptions still undefined. These are Maryland's most medically fragile residents. Cutting the workforce they rely on while capping the services that keep them safe is a double hit. It is unconscionable that the state's opening proposal, despite knowing that there were more sensible and less harmful options that were placed on the table in a variety of forums, and now place the safety and stability of our most vulnerable citizens at risk. We have seen legislative intent weekend after session before. Families have every reason to fear that once session ends, protections will erode. Let me be clear, families are not the problem. Families are the safety net when the system fails. This is not a line item, it is a lifeline. Reject these cuts, require transparency, work with stakeholders on sustainable solutions. Thank you for your time.
And thank you. And thank you for your advocacy. At this time, if we can call up Peggy Greenspan, Susan Hartung, Chris Leacock.
Yeah.
Where's the third person? Not here.
Third person's not here, I think. Good afternoon. My name is Peggy Greenspan, and the only reason I am alive and here today is because my 40-year-old my 40-year-old severely autistic, nonverbal, cognitively impaired, seizure-disordered son has provider-based services 24/7. When Ryan aged out of school in 2006, I knew my health would rapidly decline if he did not get help. I'm really sorry. I had eye surgery 2 weeks ago, and it's hard for me to read this. Ryan wakes up multiple times during the night, even with medication. He will raid the refrigerator and the pantry and the freezer. If he sees food on the ground, he will pick it up and eat it. And he will grab it from people anywhere he goes. Unfortunately, Ryan cannot take care of himself. He cannot bathe himself, shave, and even he needs help with toileting. Ryan, I'm so sorry. Needs 24/7. Okay, Ryan needs 24/7 help. Ryan needs 24/7 oversight and care, which one person cannot do alone. The people who work with my son need specialized training. When Ryan was young, my father told me I should institutionalize him. That was never going to happen. When Ryan was older, the inclusion model was pushed on me. Even part-time, that did not work. My son is living a life of dignity, being a part of the provider-based service community. With the guidance of his direct support professional staff, Ryan is not hidden away. I wish Ryan could make decisions on his own, but he can't. I realize the provider-based services are expensive, and not for everyone. I did not have a heart attack or a breakdown in 2006 because DDA knew Ryan needed provider-based services. I am heartbroken that again this year I have to remind the state of Maryland that they have a moral obligation to fund programs for their most vulnerable citizens. Thank you for your time, and I'm sorry I couldn't see what I was writing.
Thank you for letting me speak to you today. My name is Susan Hartung, and I am the Vice Chair of the IDD Commission representing over 17,000 individuals with intellectual disabilities in Montgomery County. Today, I am not speaking on their behalf because what is more important is that I am the mother of 2 children with developmental disabilities. My 40-year-old son has a rare disorder known as Cat6, and my 36-year-old daughter with autism. Today, I'd like to start with some facts. DDA is not overfunded. When compared to national benchmarks, Maryland is one of the highest tax states. Yet in terms of IDD spending, several states often offer higher per capita spending, better access, and lower waiting lists than Maryland. How then does this happen? State priorities, cultural values, politics, and leadership. MDH and DDA has presented itself as needing to cut costs. But the reality is that DDA needs to spend their money in a smarter, more efficient, and effective way, including reforming the rate structure, providing better public education, and developing known tools to better decide who needs which services with better acuity considerations and how much of that service they need. How do I know this? This year, one of my children's proposed budgets, her PCP, was sent back asking why there was an increase for a specific service, when in fact there was a decrease that had been proposed. I also had to seek professional help to complete her redetermination process and send in 70 pages of requested documentation. All of this for a woman who has been severely disabled for 36 years and cannot take care of herself. There just has to be a better way. I can also tell you that with the DDA cut of $150 million in state money, the state is giving up another $150 million in matching federal funds. Clearly, the state with a proposed budget of $70 billion could cut $150 million without losing another $150 million in federal funds. Indeed, the state's written policy is to maximize federal fund revenue. Maryland has long been a national leader in supporting individuals with developmental disabilities in their communities. The proposed cuts not only threaten to dismantle more than 3 decades of progress, the specific provider cuts target those with the most complex and serious medical and behavioral needs. There is no moral justification for the proposed cuts to DDA. They will directly and disproportionately harm Maryland's most vulnerable citizens. Thank you.
And thank you for your advocacy. And sometimes I can't see what I write. Colleagues, I'm gonna call again Chris Leacock, Betty Ricketson, Laura Lear, and I'm gonna add a fourth because of Chris and Mark Lloyd.
Chris Leacock is not here today. He's ill. Chair McCray and esteemed members of the committee, thank you for your efforts last session in preserving DDA funding. My name is Laura Lear, and I'm the CEO of Community Support Services. CSS supports 200 children and adults with significant developmental disabilities in services funded by DDA, and we employ 450 direct support professionals. Highly skilled DSPs are fundamental to the well-being and success of the people we support. The rate increases in recent years have had a tremendous positive impact on the lives of the people with developmental disabilities and their direct support professionals. Just 5 years ago, we were in the midst of our national health crisis, which led to the worst staffing shortages we have faced. I feared for the sustainability of DDA supports. The LTS rates could not have come at a better time. Rate increases have enabled CSS to raise DSP wages substantially since transitioning to LTSS. As a result, many DSPs are able to support themselves with one job and no longer need to work multiple jobs. Turnover has been dramatically reduced. For years, CSS hired 20 to 25 DSPs each month to keep up with turnover and growth. Last year, CSS hired 5 to 10 DSPs per month to maintain a fully staffed workforce. The candidate pool has improved, and not only are we hiring fewer employees every month, the quality of the people we hire is better, and they stay longer. The people we support are the true beneficiaries of the increased rates. High staff retention results in more stability and a higher quality of support. The new rate system has been a blessing. The key word here is new. It's fragile. Any cuts will jeopardize the stability of the system and all the progress that's been made. I urge you not to cut funding and services to Maryland's most vulnerable citizens. Thank you.
Good afternoon, Chairman McCray and esteemed committee members. Thank you for the opportunity to speak. My name is Mark Lloyd, and I'm the father of a wonderful 25-year-old daughter named Ingrid, pictured here. Ingrid is with a community service provider here today. And what I'd like to do, though, is talk about Ingrid. Instead of bragging about, like a proud father, about her wonderful personality and sense of humor, I'm here today to tell you of her struggles. She's a happy young woman today, but hasn't always been like this. Getting out into the community has been a challenge, and her community provider has really made a difference in her life. Sometime around her birth, Ingrid suffered bleeding on the brain, resulting in hydrocephalus, which required emergency surgery at 3 weeks of age. Just a few years later, Ingrid was diagnosed with profound autism. Since that time, we've worked to keep Ingrid from being isolated. She has worked hard over the years with wonderful aides and therapists, both at home and at school, on how to navigate this very confusing and frustrating world. But she cannot do it alone. Sadly, Ingrid has not developed spoken language, and while she has command of some sign language, to parents she also suffers from residual intellectual and sensory disabilities, all of which make communication challenging and walking alone in this world dangerous. Among her behavioral problems, Ingrid gets immensely frustrated and frequently lashes out. This is partly because of the communication. Her inability to communicate leads to frustration and outbursts that are typically short-lived, but sometimes violent. Fortunately, Ingrid's outbursts have declined dramatically after she moved into her school's residential program and then transitioned to an adult residential program and meaningful day services 6 months later with a community provider. The community provider offers safety, structure, predictability, and Ingrid is clearly much better off. Each person who works with Ingrid knows how she prefers to communicate and what activities induce stress or confusion. They also look out for the symptoms of shunt malfunction. If DDA funding is reduced and if Ingrid loses her one-on-one support, Ingrid's safety and the behavioral progress could be at risk. Please protect the DDA budget for people who need one-on-one support so they can continue to be included in the life of the community and enjoy the simple pleasures of life like a walk in the park or a trip to the mall. Thank you.
Chair McCray and members of the subcommittee, my name is Betty Ricketson, and I'm the mother of this beautiful girl, Julie. Julie is intellectually and physically impaired. She has severe visual problems. She has a severe speech impediment. And when I learned this, I knew I had to do everything that I could to help her work toward her highest possible potential. She's 52 years old now, and I would say it's all been a miracle. 40 years ago, Julie was 10, and we were looking for a new school. We didn't know what we were going to do. It felt like we had no choices back then, but we got lucky. Julie was accepted to a residential school. That was one of the hardest things I had to make a decision on. It was the right decision, though. For the next decade, we got to see her learn things and grow into her own person. But when she turned 21 and aged out of the school, once again, we didn't know what to do. I knew I couldn't help her lead the life she wanted. Then our second miracle occurred. Julie and her housemate became the very first residents with a brand new provider. She moved into an apartment in a typical neighborhood with 24-hour trained staff support. This changed everything. Within the first year, Julie had a paid part-time job with one-on-one support. She proudly held that same job for 25 years until the restaurant where she worked closed. She chose to participate in fitness classes, water aerobics, and community activities. That was all available for her. Behind all of the progress are her dedicated staff. They know Julie as well as I do. They can look at her face and understand whether she's anxious, worried, or happy, and they know exactly how to respond. She trusts them all completely. Julie receives dedicated supports because she needs that level of care. Any reductions to dedicated hours would directly reduce the supports that make her employment, safety, community life, and most importantly, her happiness possible. For people like Julie, these supports are not optional. What she has now is perfect for her, and I couldn't imagine it any other way. I urge you to protect Julie and reject policies that place arbitrary limits on human potential. For my family, because of these supports, we are able to say with confidence, all is well. Please ensure that that remains true. Thank you.
And thank you, Ms. Ricketson, Ms. Lear, and Mr. Lloyd. And Mr. Lloyd, I could hear it. You brought joy to my heart when you said a proud dad. I could hear it in your voice. Colleagues, if we can bring up Mr. Josh Delclose, Mark Wong, and Peter Mattis.
Senator McCray, Peter Mattis is not here from our organization. I am signed up. Can I take this? Thank you.
Chairman McCray, members of the committee, thank you so much. My name is Mark Wong. My son Kyle has profound autism, cared for by an amazing provider. Now 34 years old, he's doing much better thanks to that provider. But this is a familiar story. Growing up, like many of the families, it was a hellacious ride. He was a sweet, adorable kid one moment, and then the next, spitting, banging his head, attacking his sister, attacking us. We learned you can't just love him out of that kind of disability. Kyle's mom in particular left her career, taught him at home for years, fought him off more than once, and a lot of life she was fearing for her safety in our home. Later in public school, the biting, kicking, and hitting of his teachers got worse, took him out of school for everyone's safety. I tried homeschooling. One day out at the community library, he surprised me by suddenly hitting a stranger. The police were called, and it seemed I aged 20 years that day. Kyle and we needed help and change. Guardian Angels found a provider, rescued us, offered wraparound medical and psychological services, a home for Kyle to live in, social life and activities for him and vocational training. He became happier and the violence reduced. His special medication needs constant monitoring for life-threatening side effects. Our provider does all this to keep him happy and safe. They create a whole world for him, a platform to live out in the community, and a safe haven of specially trained staff who know and care for him deeply. They're special human beings who aren't paid enough. We know that with our provider, Kyle will always keep growing, but he will never grow up. He'll never marry, he'll never handle money, take his own medications, or keep himself safe. Kyle needs intensive services and always will. We could try at home, but we won't live forever. I also care for a 96-year-old mother, and I'm getting old. We realize that our provider is the only one that can be Kyle's 24/7 family. To get us through this, cutting the lifeblood funding for Kyle's provider family and other kids like him would be a tragedy. We beg you not to do that. Thank you so much.
Good afternoon, Honorable Chairman and members of the committee. My name is Josh Delclose, and I'm 39 years old. I live in the sorry. Can you guys hear me? All right, I'll restart it. That's okay. Good afternoon, Honorable Chairman and members of this committee. My name is Josh Delclose. I am 39 years old, and I live in the Northern Chesapeake Region Community Living Program. My journey navigating residential services started when I was in my early 20s with no success. Then in 2022, my mom had a health scare. This time, I realized I needed to get serious about finding a residential program while my parents were still alive. The reality is, our family members get older, and they cannot take care of us any longer. They can and will pass away. We need these services to fill the void when our family members pass away. We need these services to lift the incredible burden that family members face every day. Once I found the community living program, my life was changed. Living in a program with affordable housing, transportation, and other supports was exactly what I needed. Last year, I almost lost my waiver eligibility because my application was not approved on time and I was almost kicked off the waiver. My parents got assistance from the Disability Rights Maryland, and we were able to restore my funding. I want lawmakers to step into my shoes and think about how it would feel to lose your services, to lose your home. These budget cuts make me very worried, and I feel like I did when I was almost kicked off the waiver. Please ensure that you protect people with disabilities and fully fund our services and supports. We, the disability community, cannot do this without you. Thank you for letting me speak today.
And thank you, Mr. Delclose. If Sarah Butts is here with you, if she wants to come up too.
Josh, you did an excellent job explaining your experience. Thank you for your advocacy.
You're welcome.
Josh serves on the board of SCI, and I'm the Vice President of Government Relations for Service Coordination, Inc. So thank you.
You're welcome.
Chair McCray, did you want me to provide my testimony now? Please. Okay. Good afternoon, Chair, members of the committee, and guests. My name is Sarah Butts. I am a social worker by training and Vice President of Government Relations for Service Coordination, Inc. First, I want to start off by saying that all DDA waiver participants are required to receive targeted conflict-free case management. Of the approximately 19,000 total people that receive DDA waiver services, SCI supports 12,000 of those individuals through our Coordination of Community Services, or CCS program. That's roughly 60% of every DDA waiver participant. I have two sort of weedy issues that I'd like to explain to the committee. One is regarding a story behind this chart that's included in the DLS analysis, which regards the performance in meeting person-centered plans and timeliness. There is a blue line here that indicates that Coordination of Community Service providers are only meeting their timelines at 62%. This is not a full measure of performance of CCS. There are many dependencies, as the department testified, that include actions by individuals supported, the family, direct care providers. There's assessments that need to be completed. There's required meetings. There's timeframes for all of these things. And so this is an indication of the complexity within our system. The analyst also recommended that there be a report on barriers. Just want to flag that in LTSS, there is not a mechanism to track all of the varied requirements through that 90 or 120-day process that is required to meet these goals. So want to shout out to our numerous CCS providers for all their hard work and just recognize this is an area for improvement in our system. The second item that I'd like to flag is regarding the proposed cost containment. We are concerned that the containment measures could negatively impact people receiving services, threaten staffing stability, and increase administrative burden. Specifically, CCS organizations, including SCI, are going to be on the front lines of implementing DDA's proposed cost containment measures, particularly the $500,000 individual budget cap. It's important to recognize that reducing budgets will not reduce medical complexity, acuity, or essential care needs, and the implementation will be operationally complex. The department is recommending a July 1 timeline for revision of as many as 1,600 DDA waiver participant plans. We could have to revise those plans for hundreds of individuals, and we are already having a hard time with timelines and meeting the requirements. So this would be a huge amount of work leading to through July 1 for providers, for CCS providers in particular. Thank you for this opportunity. We just want to reinforce the importance of a robust service array for people with disabilities, choice and availability of options for specialized services that DDA waiver participants need. These are essential for community-based care. Thank you for the opportunity.
Okay, thank you, Chair McCray and committee members. Appreciate this opportunity to speak to you. My name is Patty Saylor. I'm a nurse. I've worked for over 260 people who self-direct their services during the 20 years since we've started self-direction. My son Ethan was also a self-directed participant before his death. I'm currently a board member of the Self-Directed Advocacy Network, and we're very grateful for the 10 years we've been able to work with the DDA, and we voice our commitment to continue to work directly with other advocates and the DDA on cost containment. But we are very seriously concerned about the well-being of participants, as you've heard from most all speakers. It's true that DDA has spent much time and energy engaging stakeholders and meeting with advocates this past year. I really feel like I was at every single one of those meetings. I no longer have Ethan to worry about, or I wouldn't be there. This is more concerning to me because people who self-direct have been very clear and unwavering about the two things that they must have to continue to their self-directed lives, and those are their direct support staff and administrative support to be able to pull their program together. Obviously, wages must be maintained in order to attract and maintain quality staffing. Paychecks were cut last year and pending this year. One staff recently said, "This is the only job I've ever had where I do a great job and I'm asked to take a cut in my paycheck 2 years in a row." Participants can offer, in self-direction, can only offer limited benefits. PTO and reimbursement for an individual healthcare policy purchased on the Maryland Exchange. They're not able to offer vision, dental, retirement, 401k, tuition reimbursement, and they are not able to give bonuses. And they can only offer these limited benefits if they have savings in their plan to cover it, once they have paid wages and the 14% fringe. We share the department's concern about reaching cost neutrality and managing growth and impending Medicaid challenges, but creating crisis in both service delivery models cannot be the answer this year. Self-direction is an affordable model when done well. We have suggestions for cost containment and sustainability, and as we move forward, we look forward to exploring those with the DDA for feasibility. Thank you.
And thank you. Thank each and every one of you all for your advocacy. And colleagues, seeing no questions, I'm gonna call up Amico Mbake, Michelle Stewart, Karen McDonough.
Hello, my name is Amico Mbake, and this is my brother, Kara Mbake. My brother was diagnosed with autism before he turned 2. At 13, we learned he had end-stage renal failure. He received a kidney transplant in 2017. Today, he lives with both autism and chronic kidney disease. Through his provider, he has teachers, nurses, behavioral specialists, and direct support professionals who ensure he is healthy and safe. Maryland has always done right by my family, and most importantly, my brother. The proposed cuts are targeting the most vulnerable individuals with the most complex needs that up until now, Maryland has always supported. What we are asking for is not something new or more. We are asking for the same dignity we have always had as Marylanders. Please do not take this away.
Good afternoon, members of the committee. My name is Michelle Stewart, and I am the proud parent of my son, Zachary, who joins me today. I am speaking on his behalf because the choices being made shape his life now and his stability moving forward. Zach is an autistic adult whose needs require coordinated support. For most of his life, his needs were primarily medical. For over 18 years, he was supported through the Model Waiver Program, so navigating waiver services and Maryland Department of Health Systems is not new to our family. Before entering DDA, Zach was served through the mental health system, which was not equipped to handle his needs and led to repeated destabilization and crisis. When Zach entered DDA services in 2020 at age 30, he began in a traditional provider model. Multiple providers across the state screened him, but none could meet his support needs. After exhausting all traditional options, self-direction became the only viable path for him in 2023. And I want to be clear with everyone in this room, self-direction works for Zachary. It works because it relies on consistent DSP staffing, behavioral supports, and rate structures that keep qualified workers in place. Zach's stability reflects his hard work and workforce investment. What I find deeply troubling is seeing wage reductions and benefit losses that directly correspond to that progress. I understand compliance requirements. The issue is how these changes are being implemented. Cutting workforce supports after progress puts that progress at risk. Destabilizing his supports risks sending us back to a level of cost to the state through inpatient hospitalization behavioral health crisis. More importantly, that would be inhumane to do that to Zach. Protecting what prevents crisis reduces costs, and preserves dignity. And it is my son's dignity and the dignity of all self-directed participants that needs and deserve services that I am fighting for today. Thank you.
Hi, my name is Zach. Self-direction has saved me. It helps me make better choices because I have my support person with me. I feel safe and confident when she's there. I have worked hard with my behavioral specialist, Ms. Marla, and I have made a lot of progress. Now I am looking for volunteer opportunities in my community with my support person. I really like to volunteer to work with the elderly for Delegate Kipke's Senate campaign. Either way, I'd be doing something that's of interest and importance to me. I trust my DSP. She understands me and assists me when I need it. Her wages matter so I don't lose the support that helps me make good choices in my life. Also, it's unfortunate that we need to be here in Annapolis fighting for our employees' wages and our services. Today is World Pokemon Day, the 30th anniversary, and I might rather be celebrating that. Thank you.
I don't know how to follow that Pokemon reference, so that's great. Chairman of the committee and committee members, thank you for your time and attention this afternoon. My name is Karen McDonough. I left my big picture of my handsome Sean and his DSP at home, so probably can't see this on the phone. I want to share with you our family story as those who love and support a family member who is disabled. When our son Sean was born at 31 weeks and soon thereafter diagnosed with cerebral palsy and several other things, our world shifted. The future we dreamed turned into a bit of mourning for that future, and we had to develop dreams for a happy, handsome boy who would need us for the rest of our lives. Dreams of him going to college, getting married, and having a son of his own drifted away. Fast forward to now, and us as aging parents having to plan for a time when we are no longer there for him, and where his sister, who loves him very much, would have to simultaneously mourn her parents and figure out how to support her brother. He is a 32-year-old who needs 100% assistance for everything, literally, dressing, eating, bathrooming, managing money, the list goes on, as you've heard from many other parents. As one parent very aptly said, we can't love them out of their disability as much as we wish we could. We feel blessed that he is able to go to a day program that gives him engagement with others, a variety of activities and places to go. He can live in a home with friends and be well cared for and safe. The cuts that are proposed in the budget would directly affect his present and his future. If he could not have the supports he currently has, he would be forced to be more isolated in a much less enriching environment and without the opportunities he has now. We oppose the proposed DDA budget cuts. These reductions would be damaging and destabilizing for people with developmental disabilities, their families, and the providers who support them. The cuts will disproportionately harm people with the most significant needs. Many individuals rely on consistent specialized supports to live safely and fully in their communities. Community-based services are a civil right. Under the Olmstead decision, people with disabilities have the right to receive services in the most integrated setting appropriate to their needs. These cuts threaten the system that makes that right real in Maryland. Individuals should not suffer because a community service model is their choice of what suits their need best. We can't keep doing the same thing and expect a different outcome. Thank you.
And thank you. Colleagues, at this time, we'll call up Carol Fry, Steve Keener, Whitney LMP.
Can I have 6 minutes?
Just kidding. That is a Zucker joke.
Are you? Oh, you guys go first. Oh, we're going first?
Over here, close to me.
Jeez, I have to move furniture. Oh.
You want to go first, Carol?
Not really.
Okay, I'll go first.
No, I'll go.
Okay, all right, go ahead.
Hi,
Am I starting now? Okay, I'm starting. Hi, my name is Carol Freed. My son, David Mitz, is 40 years old. He is severely intellectually disabled and receives supports from a community provider that offers exceptional and highly trained staff, one of whom has worked with David for 8 years. David requires one-on-one supports to keep him alive. His constant walking, despite his unsteady gait, at times leading to falls, his lack of awareness of danger, such as lying down in the middle of a street, and his frequent attempts at walking out of any building by himself, including home and doctor's offices, emphasize his need to have someone by his side at all times. Recently at home, he climbed onto a dining room chair and from a kneeling position planted his hands onto the table and began crawling on the table. A behavior consultant was in the house observing David at the time. The consultant wanted to watch what David would do without being stopped and instructed the direct support professional not to intervene. After David crawled to the end of the long table, the DSP was instructed to help David off the table safely. Last year, David's original person-centered plan with the one-on-one support was denied by DDA. It took 8 months of multiple plan versions and the eventual inclusion of a behavior plan to obtain DDA approval. Now, on the heels of last year's hard-fought battle, David's one-on-one support is again at risk, along with many other Marylanders who have complex needs. This year's proposed DDA cuts disproportionately impact people with the most intensive needs. These are individuals who require specialized care to live safely and fully in their community. Maryland has come a long way in supporting people with complex needs. I am worried that this proposal will set us back 20 years, back when David was entering adult services from high school and no day provider would accept him. Ultimately, a community provider came to his rescue and offered an appropriate setting. Thanks to that provider and sufficient funding, David flourished. He continues to flourish to this day with the support of his community providers, his family, and everyone who loves him. He deserves to live safely and fully in his community, just like the rest of us. Thank you.
I'm Steve Keener, the Executive Director for Jubilee Association of Maryland. I want to say 3 things about the dedicated hours policy change that DDA is proposing. 1, the policy change is essentially a steep rate cut, decreasing funding by about $50,000 per person per year for the same services. Put differently, we will provide 1,000 hours of unreimbursed services for each person each year. Number 2, DDA's estimate of $54 million of savings may be understated. If providers are paid $50,000 less for each of the 3,800 people that are affected by this policy change, the total would be about $190 million, more than triple DDA's estimate. Number 3, the consequences will be fewer service options for people with the highest needs and less pay for their staff. The policy will actually incentivize more expensive service models, such as one-person homes and day programs for retirees. There are better ways to find savings. For example, DDA could modestly reduce the glide path percentage for the rate for dedicated hours or for personal supports. This would more evenly and predictably achieve savings without undermining the service structure. Another option, MDH could help state-funded participants enroll in Medicaid in the waiver. This would cut the state's cost in half. Last year, MDH asked people to apply for the waiver, but gave them little time and little help. Most were denied or remain pending in the system. If MDH would deploy subject matter experts to guide people through eligibility and enrollment, the federal Medicaid match would save the state millions and harm no one. I apologize that my presentation was a little bit dense. There's more detail in the written testimony. Thank you.
Hi. I am Whitney Ellenby. I'm an attorney, and I also run a philanthropy called Autism Ambassadors, where I serve literally thousands of children and teens and adults who have autism throughout the state of Maryland. Now, some of the things that you all were bringing up were very relevant. I think some of your questions had to do to the DDA with accountability. And when I look at this situation, I see a disparate impact. Because what I see is that this current administration, for the second year in a row, is trying to slash funding for one of the most vulnerable populations. And when that happened the first time, advocates were imploring the administration, please talk to us and let us explain to you that with all due respect, DDA's numbers are not always accurate. Their projections are not accurate. And it would appear that one full year later, there has been no examination of that. Now, Governor Moore did make reforms to other agencies, to child poverty, to education, to public safety, without slashing their funds. But somehow we are here again, a second year in a row, fighting for our children's lives, and that does feel unjust. If these cuts are approved, everyone is going to get hurt. And that is the truth across all models. I can tell you, running the Autism Ambassadors program, that every single week I am seeing new children. And I'm not talking about children who are high functioning. I'm talking about children who have profound needs, children who are going to need one-to-one support, which is who is going to be impacted right now. Our state already lost over 10 children due to fatal drownings because they didn't have adequate supervision. Now imagine what is going to happen if we remove the DSPs and the one-to-one supervision for our children. Please, I am begging you, on behalf of our children, there is a better way. Do not do this. Thank you.
Senator Zucker.
Thank you very much. Carol, did you give me a picture of David 4 years ago?
Yes.
I still have it in my office.
Great. Thank you. He's in your district, by the way.
I did not know that at the time. I'll make a copy of it and put 2 of his pictures up.
That was another good one. Seeing no further questions or comments, colleagues, at this time, if we can call up Richard Cohn, Trina Kugel, Michelle DeFeo.
Okay, I'll go first. Hi, my name's Michelle DeFeo, and I am here representing my daughter, Madison. This is a picture. You might not be able to see it from this far, but Madison was here earlier this week, and she's been here each week since session started with 2 of her team members. This week, she was here gathering support for Senator Jennings' bill, so just wanted to thank you for that, Senator Jennings. Madison was one of the first 40 participants here in Maryland for the self-direction model. At that time, it was called New Directions. This model was designed to put individuals with disabilities at the center of the decision-making process, allowing them to build and lead their own support teams. Self-direction is unique because it creates stability. Participants recruit, hire, and retain the professionals who support them every day. As a result, Madison has had the same support staff for 20, 17, and 13 years. So 3 staff have been with Madison for that long. That level of continuity is almost unheard of in any service model. These are not interchangeable support staff. They're skilled team members who understand Madison's medical needs, her communication style, her routines, and how to prevent crisis. That stability protects her health, her safety, and her quality of life. If these proposed DDA wage cuts for self-direction move forward, participants like Madison could lose their longstanding team members. Decades of trust and experience could be dismantled overnight, and once those teams break apart, they cannot be simply rebuilt. The self-direction model continues to absorb a significant share of reductions. Why are participants who have built stable, cost-effective teams being disproportionately targeted? Individuals with disabilities should not be unfairly singled out, especially when the questions remain about funds that have not been accounted for. I respectfully ask that you do not cut wages for self-directed support staff and do not reduce critical funding for all service models. Protect the workforce, protect the participants, protect the stability that has taken decades to build. And just one more thing I'd like to add. In self-direction, we don't have built-in money for lobbyists and legal professionals and representatives. We have to fundraise and at coffee shops and ask families with disabilities and their families to help pitch in, because we obviously need representation here in Annapolis and for our community. So please, please consider that.
Thank you for this opportunity. I'm Rich Combe. My deaf-blind daughter, Kate, is in self-direction only after rejections and failures under traditional. Once again this year, Kate's team faces disproportionate, crippling cuts to self-direction, which protect the traditional agency bureaucracies. $60 million off $200 million versus $54 million off $1.2 billion is disproportionate. I'm here to ask you to reject these complex, unfair cuts, and if needed, do a simple across-the-board cut of 3% to the provider rate used to budget for both models. I'll call this the funding rate. DDA consistently manipulates data to frame SDS as the driver of, quote, unsustainable growth, despite SDS being just 15% of expenditures. 21 to 24, SDS enrollment plus rate increases led to a 313% spend growth, but traditional spending rose 88% with flat enrollment, driving the majority of absolute cost increases. Yet DDA spotlights SDS's per capita rise of 84%, downplaying traditional's 82% jump. The 2017 rate study contributed rather 40% of the 80% per capita surge across both models. Hikes were equitable, yet DDA amplifies SDS-specific flexibilities without context. In SDS, DDA fails to enable payroll deductions through fiduciaries, caps healthcare reimbursement annually, excludes dependents, and bans dental and vision benefits for SDS staff. I don't blame DDA for protecting traditional agencies, the mainstay of HCBS, but they got big, became top-heavy, charged for extras, et cetera. Meanwhile, SD got bigger in numbers and influence, leading to 21 to 24, where enrollments in traditional was flat, while the overwhelming majority of Marylanders chose SDS. You can instruct DDA to go into the LTS system and lower the funding rate by 3% for a $60 million decrease. I did budget systems for 40 years. A 3% haircut off the top is never fatal. If you cut 3%, nobody in SDS will be out on the streets and nobody in traditional will go out of business. Please protect the most vulnerable Marylanders and ensure funding supports choice, not bureaucracy.
Thank you, Chair McRae, Senator Zucker, Secretary and Deputy Secretary. My name is Katrina Emerson-Kugel. I'm from SEEK, a community provider. In recent years, there has been improved communication and collaboration between DDA and the disability community, which we appreciate. We are also grateful for the openness and willingness to listen shown by members of this subcommittee who have welcomed us into your offices and really listened to our stories. This commitment to working together is critical. As people with intellectual and developmental disabilities, their support providers and families face mounting challenges on the state and federal level. For example, hundreds of people with IDD have been bumped off the waiver through the redetermination process, which has been marked by inconsistent communication and processes. Providers all across Maryland, including us, have continued supporting people who have lost their funding, resulting in millions of dollars in unreimbursed services. Losing eligibility often leads to inconsistent supports, which is at odds with the accepted best practice of stability for people with IDD. We must ensure that the 3 proposed cost savings measures in the governor's budget don't also result in a reduced level of quality supports to people with IDD. People like David, whom we support. He has autism and joined our services after his behaviors made his home an unsafe place. He lives independently, swims, volunteers, and thanks to his employment supports, he now has 2 part-time jobs. The last time I saw him, he said, "Mom and Dad are proud of me," and they are. An impact study needs to be done to measure not only the fiscal effect, but the human effect of these cuts. Our shared long-term goal needs to be the sustainability and stability of the Maryland Developmental Disabilities Administration and the community that it supports. This requires continued dialogue, collaboration, and cooperation, underscored by a genuine commitment to listen to the people with disabilities. Thank you.
And thank you. Colleagues, at this time, we'd like to call up Jonathan Martinez, Angela Knoppenberger, and Janice Hancock.
Good afternoon. My name is Janice Hancock. Might be hard for you to see, but this is my son, Timothy. He's 25 years old. He has Down syndrome, and he's been in the self-direction program for almost 3 years. I'm here because the proposed budget cuts would put his safety, his progress, and his future at risk. Before self-direction, Timothy struggled in traditional day programs. We received phone calls almost every day about spitting, yelling, self-injury, threats to others. We were asked to remove him from the program. At home, behaviors escalated. He punched walls, tore doors off hinges, harmed himself and others, and eloped from the house, requiring police involvement. Psychiatric hospitalization was suggested but failed as the facility was not equipped to support neurodivergent individuals. Self-direction changed everything. Tim hired his staff who stayed with him through the hardest moments. With behavior support added to his plan, he slowly began to stabilize. Today, difficult behaviors still happen, but they're far less and far less severe. He volunteers in the community, uses adaptive communication technology, and participates in equestrian activities. His life now has a purpose. His staff is the key. They know him well. Earlier this month, they noticed subtle changes in his behavior, something only people who truly understand him would catch. That observation led to a diagnosis of a severe infection, and because they acted quickly, Tim received timely hospital care and avoided a prolonged stay. That is what quality looks like. That's what quality care looks like. That's what makes self-direction work. The proposed cuts happen. This ends for Timothy. Staff who must support their families can't stay if their wages are reduced. If Tim loses staff, he risks returning to the behavior that once put him and our family at risk. He loses his independence and his dignity, everything that he has worked so hard to build. Tim has potential. His life just is starting. These cuts would undo his progress. DDA states that they support his community living the way they want in the places they want to live. If these cuts happen, that will not happen. I urge you to propose these cuts, send them back to DDA, require them to work with stakeholders to create a budget that will uplift, not harm Marylanders with disabilities. No one left behind must include people like Tim.
Good afternoon, Senators. Thank you for having me here. My name is Angie Knoppenberger, and I have 2 teenagers with significant disabilities currently using the self-directed services model. I'm coming to you today to fight for them since they can't use their voices to do so. I can't believe that we are having to come again to fight for a population of people that have the kindest hearts and just want to be given equal care. Both of my children have a dedicated one-on-one at school, but require 2 to 3 additional staff when their behaviors are at their worst each day. And yet DDA says their needs are not severe enough to justify services they have received for years. Would it be better if my children were just institutionalized and would cost the state another $150,000 a year? What is happening here? I am a social worker in Baltimore City. For over 24 years, I have been a dedicated mental health therapist helping families in many difficult situations. I am also a personal support for both of my kids, and this is the most challenging support I provide. Being a personal support requires you to be constantly thinking out of the box, be sharp, present, kind, understand their needs, and do this in a matter of seconds all of the time. This important job should not be facing pay cuts of 30 to 40%. While a written testimony is important, I think the gravity and severity of this current situation deserves to be heard from a human voice. I'm begging you to take a few minutes and ask me how DDA's actions are impacting my family. I'm speaking out because my situation is very similar to many of us here.
And thank you for your advocacy. Colleagues, I'm going to call this name another time because he didn't come up, but Jonathan Martinez, just in case he's inside the vestibule.
Excuse me, Senator McCray.
Yes, ma'am.
He's our representative.
Okay, thank you. Yes, ma'am. Scott Thigpen, Lisa Green, Joe and Carver.
Okay. Good afternoon. My name is Lisa Green, and I have been in this field for 40 years. But today I'm talking to you as a mother whose son receives self-directed services. I speak to you not only as a parent, but as someone whose life has been shaped by what happens when support systems fail and what becomes possible when they succeed. February 10th marked 26 years since my brother Michael died while under the care of Rosewood Center under cost containment measures. Before his placement, he lived at home with our family. There was no in-home supports, community services, or real alternatives. My parents kept him home as long as they could, until my mother became terminally ill with cancer, and there was no other choice. I was 12 years old, and I did not see my brother again until I was an adult. That is the cost of a system without support. Years later, we adopted our son Spencer, who came from an institutional setting and carries that trauma. He faces challenges, impulsive behaviors, self-injury, and emotional crises. But today, because of self-directed services, Spencer is thriving. He has support built around his needs, people who understand him, routines that help him succeed, and tools that help him communicate and regulate. He is discovering his talents. One of his photographs is currently on display over at the House of Delegates. Self-direction is not just a service. It is the difference between surviving and thriving. Without these supports, individuals and families face impossible choices, leaving jobs, losing stability, or losing the ability to remain in a community. My family has lived both sides of this system, the devastation of no support and the transformation of when support is there. I respectfully urge you, do not cut services that directly support these individuals. If reductions must be made, they must be found elsewhere. Thank you.
My name is Scott Thigpen, and I want to thank you for the opportunity to testify today. I'm going to tell a very similar story to other people, but I want to also talk about a little bit of what I see as a flaw in the logic that the state is using to allocate these cuts. So first of all, let me tell my story of my daughter, Alexa. She's 26 years old. She's very complex. She has autism. She has seizure disorder, intellectual disabilities, defiance disorder, outbursts of violence. She's immunocompromised. When she graduated from high school in 2020, I went to the community service providers, the traditional providers in Montgomery County. 18 rejected her outright. And the 2 that she tried, they could not provide the services she wanted, and so she was effectively excluded from that model, which is when I turned to self-directed support. Over the 4 years she's been in it, she is now, not only is her violence abated, many of the outcomes that we've talked about today are, we're seeing, she's even started her own business. She cleans people's houses, she does small tasks for people, she's really thrived under self-direction. And here we are, and the logic the state is using is that the rates that we pay our people should match those in the traditional model. And I'm going to argue that that is illogical for a number of reasons. First of all, you are automatically dealing with the most complex and the most troubling people in some ways in the system. People have enormous potential, but need people that are dedicated to them, that are out in the community one by one by themselves without any support, and you're expecting to pay the same wages that traditional poor. We cannot provide comprehensive benefits. We just can't. We can provide some benefits, but not comprehensive benefits. Third, I need consistency. She thrives on consistency, and I'll tell you, no offense to the people in the room that are in the turnover is a big problem. That was a big problem with her care. So I'm asking that you rethink this and not use false comparisons to set the wages of the people in the self-directed services. Thank you.
My name is Joanne Carberry, and I'm here on behalf of my son, Christopher. First of all, I just wanted to say thank you to everybody at DDA who dedicates themselves to a life of service, and I realize that there are a lot of people to be served. I'm here to advocate for my son. Who's with me today is his special education teacher who has master's degrees in ABA and autism and DBT therapy. My son has severe autism, he has intellectual disabilities, he has intermittent explosive disorder. He cannot go into a regular program, he's not allowed to stay. He's 6'3". He's very charismatic at times and he is very charming, but he also is very, very destructive. I've been on the receiving end of that anger and violence for a long time. He destroys property and he's a danger to himself and to the community. But he has a lot to offer, so I fight and I fight. And I was very fortunate to be Jordan over 10 years ago who started working with me part-time. Before we had any services at all, my son was at Shepherd Pratt repeatedly for months and months at a time, year after year, sitting in the ER GBMC for 29 days sometimes waiting for a neuropsych bed to be available. When I found out about self-directed services, it was from a program director who thought that maybe this is something I could handle and do. I'm disabled myself, I have lupus, but I used to be an executive in a medical firm nationally. So I said, okay, let me see what it's about, let me see what I can do. Wow. We were talking about a child He was completely, he eloped out of my car at a stop sign, 3 different police, Montgomery, Howard County, and other people were trying to find him, 4 different police dogs, 2 drone teams, took 5 hours. This is a very, very disturbed person. I cannot believe the difference self-direction has done for my son. He is now, he also tried to kill himself twice. He also really is afraid and hates being autistic. His self-directed services now, he's productive. He volunteers at the library. He goes into the community. They can read him before he gets really upset. They know exactly what to do. The ABA and DBD team is part of, Jordan is part of through Kennedy Krieger, is at my house full-time. DBT services is at my house 3 or 4 hours a week, every single week for my itinerants. We have an incredible team of people that's been with him for 2.5 years without 1 hospitalization and 1 ER visit. So I just want to say, please really think about the wages that we're paying these people. They took a big pay cut last year, and none of them, even though they're so dedicated, none of them can stay for $26 without any benefits or taxes taken out of that money. That's just not going to happen. And my son will end up in jail, according to Kennedy Krieger, and the behavioral report that I have, and the intensive care that he's gotten from his psychiatrist, Dr. Renbaum, for 15 years. He will end up in jail, worse, molested, or he's going to die. And that is no exaggeration. And I cannot tell you how grateful I am to the people at DDA and everyone here who dedicates themselves to a life of service. Thank you very much. Do you want to say anything, Jordan? Okay.
Thank you, and see no questions. Colleagues, at this time, if we can bring up Melvin Stern, Mary Lynn Brennan, Beth Gould.
I'll start. Thank you, Chair and committee members, for your time. Thank you also for your work last year on the issue around budget cuts. My name is Beth Goody. I live in Rockville, and I'm representing my daughter, Caroline Monroe, who also lives in Rockville, using a housing choice voucher. Caroline's 31. She's totally dependent for all aspects of her life, and she's been self-directing for about 10 years. The SD Act of 2022 put into place something called the day-to-day administrator. And that really is for parents, families who are self-directing, a hope for sustainability. This is the key to the person that can take our place running the program, supervising staff, doing all of the things that make self-direction work. In the amendment, DDA took away the intention of that service. The committee allocated, I don't know, what was it, $70 million or something to retain that service. But the amendment eviscerated it. It can't be used. So those of us who are really working on trying to protect our children's programs and services and the life that they know are now, there's no way. We're leaving us with absolutely no option. My daughter doesn't have, once I'm gone, that's it. She's done. She needs someone that can sort of see this through. It's not a minimum wage position. It's a career. We're hiring a new mom. So, I think my ask would be that a new amendment needs to be submitted to restore that service as was intended, and with one other piece of information to restore language in the waiver unless as authorized by DDA. They've taken away their own ability to be person-centered in their plans. Thank you.
Good afternoon, Mr. Chairman, members of the committee. I'm Melvin Stern, a pediatrician in Howard County for the last 45 years. Have been involved with the disability community for over 50 years. I'm also the father of now a 50-year-old disabled youngster, was a youngster, traumatic brain injury beginning at age 7. My story is very similar to everybody else's. She has been receiving services shortly after the brain injury. We initially funded them through insurance, then through school, and now through DDA. The reality is these people are not going to go away with cutting services. They're going to be there. The services are going to change. And in Jenny's case, when she didn't have the self-directed, she was showing up in the ER. She was showing up in the hospital to get laceration repair. She was showing up in the hospital for illness like pneumonia. She was calling the police for services because a service worker had disappeared. She was picked up on the streets because one of those service workers had taken her in the middle of the night to her boyfriend's house, had left her in the car while she was in with her boyfriend in February. It was really cold. It was sub-freezing. To send out, the police had to come out, rescue squad had to come out. So we're not talking about savings. We're talking about shifting cost, and that shift is very, very foolish, is ineffective. Those aren't the services these people need. And so my plea to you is begin to look at outcomes. If we're going to spend the money, let's get good services. And if we start cutting, we're going to require services. They're not going to go away. These people aren't going to disappear, but we're going to be providing costly services. So I would hope that we do not cut the budget, that we understand that we're going to be spending the money. Let's spend it effectively for beneficial services. Thank you very much.
Thank you, Mr. Stern. Colleagues, seeing no questions, I'm going to repeat the name. Mary Lynn Brennan, Jessica Galentine, Deanne LeBron, and Cody Stevens.
Chair, if I can, before my time starts, Jonathan Martinez was a representative of Concerned Citizens. He was under the impression that he was going to be able to give a virtual testimony and was never given any information otherwise. We weren't sure what we should do regarding his testimony to be able to submit it.
We do in-person testimony in the subcommittee.
Okay, fair enough. Thank you.
I'm going to lean in and say, like, the written testimony is always an option, and even if he has late written testimony, we'll still take it.
Fair enough. Okay, we'll make sure we get that sent in to you guys. Anyway, so Chair, Vice Chair, members of the committee, my name is Cody Stevens. I'm here as a regional lead for Concerned Citizens of Maryland SDS and a member of the MidSec. But first, I'm here as a father. My son Luke lives with severe epilepsy and complex neurological disabilities. He has undergone 2 major brain surgeries, including a full right hemispherectomy. His day-to-day needs are unpredictable. His safety depends on trained, consistent support staff who understands his medical complexities. When the state imposes deep cuts on Developmental Disabilities Administration and the DDA responds by drastically cutting wages, creating budget caps, and restructuring supports, those are not administrative adjustments to participants. Those are direct threats to their safety and stability. Under the Supreme Court's Olmstead decision, Maryland has a legal obligation to serve Marylanders with disabilities in the least restrictive setting appropriate, in their homes and communities, not in institutions where I promised my son he would never go. We're already operating in a system under strain, as nationally, the direct support workforce has experienced vacancy rates exceeding 20%, or turnover often above 40% annually. When you reduce wages further, you do not create efficiency, you accelerate the collapse of these programs. In 2022, Maryland passed the Self-Direction Act, affirming that individuals with disabilities have the right to control their own services and direct their own care, grounded in dignity, autonomy, and person-centered planning. Across the state, participants are already losing staff, parents are already leaving the work or having to leave the workforce. Participants are losing community programs, therapies, and routines that took years to build. Entire lifestyles are being upended in mere preparation of these cuts going into effect. Off of my statements, I know a lot of you have kids. When it comes down to it, I can't explain to you what it feels like to have that diagnosis from the hospital, let alone trying to redirect your life and reset your motion forward. I was asked by multiple legislators actually to run in this year's campaign and put it aside because my son's needs are much more complex than anything, respectfully, that I could ever do here. But I want you to consider that, because given your positions, I'm not sure you would be able to do what you do either. I'm not going to judge, but here's what I do want to ask. We're not asking for excess. We're not asking for we are asking for compliance with federal law. We're asking you to uphold the promises made in the Self-Direction Act. We want to make sure that these families are not just budget lines. These are lives, and they're all on the line today. Thank you.
Hi, guys. Good afternoon. My name is Jess Gallatin. I'm here again for the second year in a row. I think some of you guys met my sister, who is a participant in this program. I brought my son with me today because I just needed some support because I lost my cool a little bit yesterday, so I'm just trying to regather myself. Did not prepare written testimony because I'm exhausted. So I've just got a bunch of random notes. The one thing that my son wrote on the top of my paper here, which I think is funny, so I got a sticker on my truck that says that, and it's, nobody cares, work harder. And that's like a mantra in our house. I say it to my kids, I say it to my sister, and I say it to myself 100 times a day. So I'm very frustrated because I need to know if I'm making sense. Am I teaching my kids the right thing when I tell them nobody cares, work harder? Because the harder we work at efficiency and the harder we contribute at taking care of our own family members, even when we're not legally responsible to, it doesn't seem to matter. I don't want to forget about talking about my sister's issue, because I think I did yesterday. I wrote down a couple of things that I think are important to know. Last year, it took 298 days for her PCP to be approved. We had 67 days of an approval, so 9 weeks, and then her plan was due again, and it's still not approved. We are 179 days into waiting for her plan to be approved. And she is a nonverbal quadriplegic with a lot of issues. And I don't want to forget about advocating for her, because that's why I'm really here. But I think the bigger issue is that we have big problems here. The cost containment actions proposed are disproportionate, okay? These in self-direction, they don't get to absorb costs wherever they find it to be the easiest or the most efficient, you know, not upgrading softwares, not renewing fleets. You're affecting the wages. And that's what the program was built off of. Self-direction was like a waiver. You know, the waiver was supposed to be more efficient than Medicaid. Self-direction is supposed to be more efficient. We give you the same dollars and let us put it where we need it. And they most often go towards their DSPs. So it just needs to start making sense. Thank you for your time, guys.
Senator Zucker.
Thank you very much. What was the mantra again that you said?
Nobody cares, work harder.
Well, you have to, I would just say you updated to we all care. And, we're going to work hard.
Okay, good, thank you.
Seeing no further comments or questions, I'm going to repeat the name. Deanne Flerbone, Lisa Roberts, Allison Hamilton, and Joan Warren. Thank you. Yes, sir.
flying solo up here, I guess.
No, I just had to get out.
All right. Good afternoon, Chair McCray and committee members. I'm Allison Hamilton from Crofton, and I'm both parent and guardian to Leah, a young woman with autism who receives self-directed services. I tried to find a provider agency when Leah exited school in 2022, and I was not successful. Some agencies were in flux from COVID, and a couple had bright red flags flying. I'm a social worker, so my radar is pretty good. And the one that seemed like an excellent fit, specialized in her disability, rejected her because she required one-to-one support. Leah is not alone. It's been a common problem among self-directed participants. If they can't fit neatly into a 1-to-4 staffing ratio, if they have behavior needs, or if they have complex medical issues, they are a lot less likely to find a place at a provider agency program. So that's how we got here, out of necessity. It was clear that self-direction was the only way for Leah to access services. And as Director of Operations and the HR department for Team Leah, I can tell you that if these proposed wage cuts move forward, Leah's lead direct support professional, who is excellent, won't be able to afford to stay with us. I'm not looking forward to the day when I have to tell Leah that Najee can't be with us anymore. These cuts will create a situation in which some of Maryland's neediest residents will be denied services. I mean, not technically. On paper, they'll still be in the LTSS system. Leah will still have a person-centered plan. She'll still have a budget. But in reality, if we lose Najee, we will have great difficulty replacing her, especially at the proposed BLS rate of about $23 an hour. At that rate, I doubt we'll be able to attract any serious applicants. So without Najee, Leah won't be receiving services while we look to replace her. In the real world, how's that any different from a denial of services? And how does that fit with the message of no one left behind? Thank you for your attention this afternoon, and I hope your help.
Okay, just want to make sure there was no questions. Thank you very much again for allowing us all to speak today. We appreciate it. We know it's a long day, so I want to go a little bit off script. My name is Joan Warren. I am the mother of Christine Warren. Christine was born profoundly intellectually and developmentally disabled due to a severe recessive genetic disorder, Smith-Lemli-Opitz syndrome, 1 in 60,000. She has been part of the DDA system since birth. She was supposed to die in the first 6 months. I am also, in my other life, which actually is now former life, PhD, registered nurse, educator, healthcare executive, and researcher. I'm here today because I believe Maryland stands at moral crossroads. The state's Developmental Disabilities Administration is grappling with the $150 million budget shortfall, but its proposed solution threatens the very foundation of care for Marylanders and intellectually and developmentally disabled. They are forcing 4,000 self-directed families to absorb $62 million, 41% of the deficit, through wage cuts and tighter limits on essential services. This is going to risk and undermine safety, independence, and disabled residents and the trust of our public institutions. We've heard that today over and over. Where my concerns are, and this is where I go off script, has been because this is a highly complex issue. We know that LTSS has contributed to some of this shortfall. We know that the payment model change has contributed to this shortfall. We know that the increases in enrollment have contributed to this shortfall. But what's not being spoken about today is that there are other things that are happening within our Maryland Department of Health, as well as within the DDA, that may also be contributing to this shortfall. And these things are what has been posted in the newspapers repeatedly, where we had the Washington Post going all the way back to 2023, $1.4 billion in expenditures, lacking proper documentation for federal reimbursement. We have the DDA reporting that they have not still collected the $119 million. And I bring that forward because it's what drove me as an individual years ago last year after reading a Maryland Department of, a Baltimore Sun article about wages to start to examine the Maryland Department of Health wages. So I actually went to the 2024 MDH the Maryland Government Pay and Compensation Database. I downloaded, it took me a week, 8,000 employee names and their wages, which included gross pay, overtime, and another column called Other. In those findings, essentially what I found was that within this analysis, 7,698 employees, a lot of disparities. Of those earning $50,000 or more, a small cohort of Maryland Department of Health employees received a disproportionate share of the total compensation. The top 6% of workers claimed 18% of the total payroll. 494 individuals earned more than the governor's salary at that date in 2024, which was $188,000 reported, again, in the Baltimore Sun. We had one individual on the database that was earning $728,000, and that was a combination of both the base wage as well as with the other category. The same group also, all these high excessive wage earners, claimed $49 million in overtime and another $11.8 million in unexplained pay. Again, that other group. So while high-level Maryland Department of Health employees enjoy lucrative compensation and benefits, frontline DSPs, those providing essential hands-on care, receive little or no real substance. I mean, when you're looking at pay going from 32 and hearing today, potentially down to as low as 18.
Ms. Warren, if you could start to wrap up.
Yes, $18 an hour. I think that's really something that's concerning. So I think at this point, we are showing that we are not valuing them. We're slashing DSP wages that, are going to deepen poverty, fuel turnover, and essentially you can only slash wages for so long before you start to disrupt the entire system. Wages are a finite amount of money. You cannot continue this process. This is cost cutting. It is not cost containment. And I will end there. Thank you.
Thank you. Colleagues, I'm going to call her name one more time as she didn't come up. Lisa Roberts. Also going to call Brian Sylvia and Sherry Oliver.
Mr. Chairman, if Brian's father could accompany him.
Please.
So you can just tell them who you are, and you're here because of MIH, Maryland Inclusive Housing, and what they've done for you. Okay?
So I'm Brian Sylvia. I'm here for Maryland Inclusive Housing. And this is how I got my apartment, or how I got to live on my own.
Anything else?
I became more independent when I got my apartment. And it's really helping me. Really good.
I'm good. Thank you. I wanted to add a little bit for Brian, if I could, please. Maryland Inclusive Housing has given Brian services of an apartment and the ability to live independently in a community that he works a part-time job, participates in 3 different Special Olympic sports, and many other community activities. His own apartment has allowed him to broaden his social network of friends and neighbors that give him a normal life outside his immediate family. Maryland Inclusive Housing has provided Brian with an apartment a couple miles from a job at a Harris Teeter grocery store that has voted him the Employee of the Month on 2 different occasions. So, that's all we have for Maryland Inclusive Housing. Thank you for listening.
Yes, sir. And Brian, it's great to see you and super familiar with the work that happens over there with Tim and them. Colleagues, at this time, I want to ask, you got J.B. Jennings.
I just want to say, Brian, good to hear from you. Glad to see you living independently like that, and glad to see the program working. But I do want to say, as somebody that has to do the polar bear plunge, I've done it now for, I think, 6 years. I'm glad to see you doing Special Olympics, too. I hope you like it and enjoy it.
Thank you. Thank you.
Any other questions?
No, sir, but I would like to ask the public if there is anyone that signed up for public testimony that I did not call, did not get an opportunity to speak, please come up to the mic at this time.
Okay. All right. My name is Michael Yates. I'm the CEO of Chester Wise Center. We support people with developmental disabilities on the Eastern Shore. I wanted to talk about the dedicated hours and the cap cuts. At Chester Wise, we support about 60 individuals between Queen Anne's County, Talbot, and Kent County. And we have about 17 folks who have dedicated hours. And what I have experienced through DDA is that we support people with a lot of medical issues who don't have behavioral plans and things like that. And DDA has cut multiple people that we support who have like 24 hours, dedicated hours due to their medical needs down to zero. It hasn't been anything in between. What DDA has told me at the regional office is that these people no longer meet the assessed need, or dedicated hours is a restrictive service. And I need to present them something else that proves to them why these hours are needed. The two people that I'm talking about have received dedicated hours for over 10 years, a part of their PCP plans due to their medical needs, due to them being in wheelchairs, nonverbal, need staff support for every ADL thing in their life to access the community, every part of their daily life. So that is really where Chester Y has hit huge roadblocks, and especially for the folks that we support that have intense medical needs, that we are left to provide it without reimbursement or file appeal. And I've been waiting over 90 days for an appeal date for those folks. So that is what I wanted to say. Thank you.
Thank you. I want to give my colleagues an opportunity to be able to comment on what we did here today. We heard a lot today, a number of advocates, a number of family members, and things of that nature. I'll start with you, Senator Zucker.
Sure. I think, thank you very much, Mr. Chairman, for your leadership. And certainly, what's interesting is these issues aren't defined by political party. I mean, you heard Senator Jennings speak earlier and his passion around these issues. And, we understand, even though we're a budget committee, we understand full well that there are people behind these numbers. And the impact of, the impact that services provide in a positive way. And we certainly understand the impact of what happens when there are budget cuts. Many of us are in these positions and run for office because we care deeply about people. We care deeply about people, whether they're in Harford County or Baltimore County or Baltimore City or Montgomery County. These are difficult times, and we've seen firsthand the impact it's had. but just know that this subcommittee is committed to helping people, to lifting people up, and that, we continue to do our best on behalf of all Marylanders. We also understand that there's more that of course needs to be done, but just know that you've got strong partners with us. Thank you, Mr. Chairman.
Senator Jennings.
Thank you, Mr. Chairman. This is a tough issue. This is the hard part of this job. The testimony we heard from all these families, the individuals that receive these services, this is what government does, providing these type of services to people that need it and must receive it. We're trying to sharpen our pencils and balance our budget. As I always say, people always come in our office asking for money. Nobody's ever come in giving us money back. It's not only this subcommittee, but it's the other two subcommittees, across the halls that they're dealing with their budgets also, that there's programs that are important to everybody. But these, the difference is, this program and this is life-saving. These are people's way of lives. As Senator Zucker said, both of us have been working with, and not you too, Mr. Chairman, with the secretary. She's been extremely, as I mentioned when I first spoke, open to our offices with communication. She understands, both the job she has of dealing with this, with the cost containment, but also providing the services that these people need. There's not an infinite amount of money out there. So it is tough to the families out there. We are trying our best to make sure that we provide everything. Last year, look at what we were facing, and we were able to get it done. This year, we're going to do our best. Remember, we can't give everything. So, there will be some cuts. I don't know where we're going to be. I don't know where it's going to end up, but it's not going to be 100% of what everybody wants. That's part of this job is trying to make these decisions. Not everybody's going to be happy, but it is what we have to do because, we have a lot of programs that we have to fund across this state. So, that's the hard part of this job. That's why we've been sitting here for almost 4 hours listening to this testimony. Most of these agencies that come before us take, the analyst, half hour? We're in and out of here. 4 hours shows you how important this is. So I thank you for being here. I thank you for this testimony. And it makes it, it's a much stronger impact and when we make these decisions. So thank you, Mr. Chairman.
Thank you, Senators Jennings. And if I could just lean in and say, just listening to the stories, Tim, whether we're talking about housing, I heard about working 2 part-time jobs. I heard about the mother, the father. I heard the father's joy when he talked about his daughter. So many different stories that we were able to hear over the past several hours. And I think about, some of the philosophies or some of the words, nobody cares, work harder. And that's one of the ones that I subscribe to, but I'm glad that my colleague, because this is a very thoughtful body, said we do care. And I tell you, I've served in this body for 12 legislative sessions, and I tell you that that's one of the things that I feel like I've moved in a better direction of just being more thoughtful, ensuring that we do roll up our sleeves, do the hard work, and folks that do care. It's nobody that I want to be in the trenches with, figuring out these tough solutions, than Senator Jennings, Senator Augustine, and Senator Zucker. And I just lean back and I reflect back on the 44 decades that I've spent on this earth. And I see so many young people that do not get the opportunity to meet their full potential. And I heard from so many people that are currently right now getting that opportunity to meet that potential. And that's what I think about each and every day. And I believe that that's the #1 reason why many of us serve from that standpoint. So I just want to lean in and say thank you again to each and every person that not just showed up, but maybe they sent the email. Maybe they called. maybe they told a friend about what was going on in the conversation that was happening, just to amplify and educate around the conversation. I do want to lean in and look over to my left, and I speak to my secretary and I speak to my deputy secretary. I believe that the communication that has taken place with the second floor and the agency has definitely improved over this period of time. I was sitting here setting meetings, even Monday, around this specific issue. So I do want to say thank you for the communication. We all look forward to working in partnership to figure out these very complex issues and puzzles that we have in front of us. And Ms. Martinez, I do not want to forget you. Because at the end of the day, you know, we do not do this job by ourselves as legislators. It is the group of people that work with us each and every day to help us, give us better insight, and make sure that the decisions that we make are the right decisions because we have the information. And I wanted to say thank you. Colleagues, seeing that this is the only agency report, this ends the hearing for Health and Human Services, and look forward to seeing everybody Monday.